Testing. Hello? 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 Hello?
Yes, it's okay. Don't mute.
Honourable Ministers, the delegates from the Pacific Islands, ladies and gentlemen, so we are now start our meeting this morning. Before we start, I would like to announce that our chairman, Honorable State Minister Yamamoto of Japan, has to attend the important matters, and I have the privilege to take over, and I will do my best to ensure efficiency in the conduct of the proceedings. Honorable Ministers, now we resume our considerations of Agenda Item 9 on primary health care, following yesterday's very interesting panel discussions. If you wish to speak, please indicate by clicking the big button on your microphone if you are in the plenary, or by using the raise hand functions on Zoom. Accordingly, may I now call the representatives from the country to be followed. May I ask Brunei to take the floor. The floor is yours, Brunei.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. The Chair, Honorable Ministers, distinguished delegates, ladies and gentlemen. Brunei Darussalam has always and will continue to be committed to strengthen our primary healthcare system in achieving universal health coverage, as stated in the Declaration of Alma-Ata and reaffirmed in the Declaration of Astana. Our commitment is reflected in the Ministry of Health's Strategic Plan 2019 to 2023 goal of excellence in healthcare service by assuring the provision of universal health coverage, ensuring accessible and equitable healthcare to all, as well as strengthening primary healthcare in the country. Brunei Darussalam is unfortunately not spared from the COVID-19 pandemic. The primary healthcare system had to implement various strategies with the priority of maintaining the delivery of essential health services, especially to the vulnerable groups, for example, those who are under 5 for immunizations, the aged population, maternal health, and those with chronic conditions. Measures taken includes the reallocation of services into influenza-like illnesses clinics and mass swabbing centers to relieve the pressure from the hospitals. At the same time, the workforce allocations, essential supplies and PPE stocks, laboratory facilities, as well as the standard operating procedures had to be considered. The Brunei Darussalam's national COVID vaccination program is a concerted effort by the whole nation. To ensure accessibility and equity, the vaccines were not just given at the vaccination and health centers, but also in the rural areas by our mobile vaccination teams. During this difficult time, Brunei Darussalam's primary care adopted alternative approaches to the delivery of essential primary care services. With the current national electronic one patient, one record system called the Blue Health, teleconsultation and extended prescriptions is now the norm with the remote monitoring of patients. There has been an increase in the number of home deliveries of medications for those. On a more positive note, the pandemic expedited Brunei Darussalam's plan towards a one-platform digital health for the public and the private healthcare providers. The Mini HIS platform provides information essentials for the best care of the patients, including access to medical records and the reporting of infectious diseases, amongst others. Lastly, Brunei Darussalam commends the World Health Organization for its effort in providing guidance on the role of primary care in the COVID-19 response and in order to achieve universal health coverage. Thank you very much.
The next speaker is Cambodia, followed by Mongolia. The floor is yours, Cambodia.
Honorable Vice Chairman, Honorable Dr. Takashi Kasai, WHO Regional Director for the Western Pacific, Honorable Ministers and representatives of member states, distinguished guests, ladies and gentlemen. We fully agree that reinforcing health centers in Cambodia to facilitate them being successfully integrated in communities is a key priority. We are working toward fully functioning health centers, which are comprehensive, continuous first contact for accessible and coordinated with other sectors of healthcare system as well as community. Revitalizing primary care will strengthen the position of the health center and change their role to make them ready for 2030. This change of roles will transform health centers from what is largely a disease-focused method of working where people access services only when they are sick to a patient-centered, proactive population health way of thinking. The change will move to a whole-of-system approach that interfaces regularly with community, individuals, their families, and promote the greatest level of health and well-being throughout the life course and across all sectors of healthcare. Primary healthcare services will be preferred by communities, and we expect people to enjoy using services more with no financial risk or hesitancy. Ministry of Health is developing a primary healthcare strategy and model of care for testing and scaling up. This new strategy will provide guidance for a system development that is fit for addressing anticipated future health needs. This all aligned with the Royal Government of Cambodia ambitions with Vision 2050, and we know it's in keeping with the future of primary healthcare in an evolving region. COVID-19 has introduced many challenges, but also opportunities of health centers and the health system as a whole. Primary healthcare services have been playing a major role in the success of COVID-19 response in Cambodia. Community participation as key component of primary healthcare have been significantly strengthened during COVID-19 pandemic, with local authority and community actively taking leadership in COVID-19 prevention and control, such as health education, testing, contact tracing, quarantine, home-based treatment, and support to vulnerable groups, people with disabilities, elderly people with poverty. The new primary healthcare strategy sitting alongside the new health strategic plan will build back a resilient health system and regain progress towards achieving success in the concluding years of SDGs. I thank you very much.
Thank you, Cambodia. Next on the list is Mongolia, followed by Japan.
Thank you very much, Mr. Chairperson. Very good morning, ladies and gentlemen. My government has committed to making our primary healthcare more responsible and equitable to meet the needs of the population, especially of the most vulnerable populations, including low-income and unregistered people, as well as herders residing in hard-to-reach remote areas. Facility-wise, in Mongolia, there are 7,500 primary healthcare workers working at more than 500 primary healthcare facilities, whose responsibility is to provide primary healthcare services. The package for PHC consists of health services for maternal and child health, communicable and non-communicable disease prevention and control, elderly and palliative care, and emergency medical services. Mr. Chair, the decision by the government of Mongolia dated in 2018 to expand the service package and provide funding for PHC providers for the Social Health Insurance Fund to finance services such as daycare, home care, rehabilitation, and diagnostic tests is a good example of the investment in PHC and expansion of the service package at PHC level. Moreover, our national and local governments have recognized the importance of cost effectiveness in reaching out to remote and disadvantaged population to provide integrated services using mobile technologies, along with use of essential diagnostic equipment and tests. However, Challenges remain, like other countries in the region, such as poor quality of care and capacity of healthcare workers, insufficient motivation, and referral system with not enough continuum of care. The government recognizes the importance of addressing these issues, given its impact, especially during this global pandemic and beyond. While responding to the pandemic, the government has continuously worked, towards strengthening and modernizing its healthcare system, ensuring continuity of care and quality healthcare services that are accessible to all. These reform measures include decentralization of healthcare services, transition to a single purchaser system, prioritization of preventive health examination, strengthening e-health systems, and performance-based health financing to further increase access to quality healthcare, and establishment and operationalization of the National Drug Regulatory Authority to ensure drug quality, accessibility, and price regulation. Mr. Chair, my government has also introduced innovative actions related to the delivery of essential healthcare services and COVID-19 services throughout intensified online primary healthcare services using modern technologies such as mobile health technology and capacity building and refresher trainings of PHC workers and strengthening retention mechanisms. Guided by the For the Future vision for the Western Pacific region and the operational framework for primary healthcare, Mongolia is confident that these reform measures will bring significant progress in the healthcare sector and beyond, will advance our progress towards achieving UHC. Mr. Chair, the COVID-19 has highlighted the importance of innovative approaches, including outreach services to ensure continued delivery of routine essential services, including maternal, child, reproductive health, prevention and control of communicable and non-communicable diseases, and emergency medical services. Such innovation can be applicable to other healthcare programs during and beyond the COVID-19. Mr. Chair, my government recognizes the importance of strengthening the referral system, addressing the continuum of care and patient care pathways from the primary care to the referral care levels, ensuring that referral is properly seen as a two-way process. Referral from primary to referral services where a higher level of care is needed, and return referral from referral to primary health care where that is appropriate to meet the patient needs. In addition, strengthening of multidisciplinary teams approach through on-site capacity building and in-service training programs to delivery of PHC services is very important. Such training should be based on understanding of patient care pathways that acknowledge not only the role of specialists, but also the critical role of primary healthcare worker in coordinating the patient care over the longer term. Thank you very much.
Thank you, Mongolia. Japan, followed by United States of America. The floor is yours, Japan.
Thank you, Chair, for giving me the floor. It is very timely to discuss the new generation of PHC to meet the demand of coming years where we need to face the multiple challenges such as rapid demographic and associated changes, as well as response to ongoing and future emerging infections. Yesterday, 3 ministers highlighted our common challenges and opportunities such as aging, financial sustainability, access of services, health workforce, and working with new partners. Japan celebrated 60 years after achievement of universal coverage of health insurance this year and has humble experience to share. I have 3 points. First, aging and financial stability. We have put emphasis on not only health, but total social security reform with the target of 2025, when all baby boomers become over 75. The concept is not patient-centered approach, but people-centered approach by integrating health and social services at community level. Each prefecture developed own plan to shift acute hospital beds to support community and long-term care. This moderated the growth of medical cost, but nursing care cost continues to grow, and to support the social security cost and valued added tax was increased. My second point is challenge we faced. The health resources are distributed to ensure easy access, but this brought challenge when we faced the COVID-19. Healthcare resources, including ICU and specialist healthcare workers, have been thinly distributed, which scared us if our health system is overwhelmed. My last point is what we are aiming for, the new generation of PHC in, with, or over Corona era. In my view, our basis of quality services for everyone, protect valuables, and the sustainability of resources are never changed. But we feel following additional elements are required. One is development of essential public health goods, such as vaccine and drugs for new infections. Second is enhancing surge capacity and business continuation plan for essential programs. Third, modernization of health data system to promote individual health as well as supporting timely policy formulation. They are all new domains in public health and PHC. We are committed to work with member states and WHO to develop a new PHC. Thank you.
Thank you, Japan. The floor is United States. Floor is yours. Thank you.
Thank you, Chair, and we thank the Western Pacific Regional Office for this important panel discussion on primary healthcare. Strengthening primary healthcare around the world is critical to advancing health equity and person-centered care capable of delivering critical interventions across the life course, including for maternal, child, and adolescent health, and for non-communicable disease prevention, diagnosis, and management. Primary healthcare is also at the heart of efforts to advance universal health coverage and to ensure that all groups, including those that have been historically marginalized or excluded, receive the health services they need without suffering financial hardship. The United States is working with bilateral and multilateral partners to build stronger, more resilient health systems around the world, including by investing in primary healthcare and more efficient delivery of services. Strong and resilient health systems play a critical role in the ability to prevent, detect, and respond to infectious disease threats at national, regional, and global levels. Strong primary healthcare networks also help ensure strong and resilient health systems through connecting healthy and resilient populations with good access to medical care. In addition, primary healthcare is critical to building and sustaining community trust in public health and in healthcare to meet their daily needs, and to be accessible and effective during health crises. Improving health service coverage and health outcomes also depends on the availability, the accessibility, and the capacity of health and care workers to deliver people-centered integrated care. We look forward to working together as a region to strengthen primary healthcare as we build back from the pandemic. Thank you.
United States of America. Now is Samoa to be followed by Hong Kong. Samoa, the floor is yours.
Thank you, Mr. Chairman. Samoa wishes to commend WHO for their commitment and leadership in encouraging the Western Pacific region to strengthen and revitalize primary healthcare systems. The government of Samoa fully supports the decision made for the Western Pacific region to share knowledge and expertise on how to revitalize our primary health care systems. In order for primary health care to be shifted from a disease-based approach to a system that interfaces regularly with individuals and promotes the level of health and well-being through the life cycle. Samoa's primary health care and public health systems is guided by its health sector plan of 2019, 2020, 2029 to 2030, which focuses on enhancing public health and revitalizing primary health care to provide people-centered health services to promote universal health coverage. This national strategic plan assists Samoa government in delivering people-centered service to promote health and well-being. It also reflects sector's commitment to achieving these through health-related sustainable development goals. The health commitments in 2014, Samoa Islands Development States Pathway, Healthy Islands Vision, Indicators, and National Health Strategic Outcomes in Samoa's national strategy. The main focus of strengthening Samoa's public health system and revitalizing primary health care is to take the service to the people rather than waiting for them to come to the hospital. This should bring value to place emphasis on patient focus or patient care. It will add value to a much more collaboration thinking process in terms of strategic planning, enhancing development, investments already made in the sector and advanced health workforce platform. We've developed career paths and strengthened strategic systems thinking amongst professionals to work as teams. As a way forward for Samoa, we have placed emphasis and focus back on primary health care through continuing community mobilization and engagement and empowerment through our Pay for Samoa program. We strengthen EPI programs management and implementation, strengthening the health information system through e-health developments, reduction of stockouts, improve supplies forecast of medicine and medical products, and infrastructural and human resources for health development. These developments, I believe, are all linked to strengthening and revitalization of our primary health care system. Thank you, Mr. Chairman.
Thank you, Samoa. Hong Kong, China, and to be followed by New Caledonia. The floor is yours, Hong Kong, China.
Thank you, Chairman. Good morning. Chairman, ladies and gentlemen, on behalf of Hong Kong, China, I would like to thank the WIPRO Secretariat for providing a platform for discussion on primary health care, a very important topic not only in the Western Pacific region, but also globally. We would like to share with the panels about some recent developments in Hong Kong. Hong Kong's healthcare system provides extensive healthcare services, including a low-cost public healthcare safety net that ensures that no one in Hong Kong denied medical care due to lack of means, a comprehensive primary healthcare system that can attend to the healthcare needs of individuals conveniently in a community setting is crucial to providing the overall health status, improving the overall status of the population, and also reducing unwarranted admissions and readmissions. In a bid to strengthen district-based primary healthcare services and connect a service network manned by private medical healthcare providers in the community, the Hong Kong Special Administrative Region government is committed to setting up district health centers across the territory progressively. The objectives are to raise public awareness on personal health management, enhance disease prevention, in particular, non-communicable diseases, and strengthen medical and rehabilitation services in the community, thereby reducing unwarranted use of our public hospital services. The district health center is a hub with multiple access points at convenient locations and will offer a good range of coordinated care and support services that can be a convenient alternative to frequenting a hospital. The services offered in the DHC will focus on primary, secondary, and tertiary prevention, including health promotion, health assessment, chronic disease management, and also community rehabilitation. DHC services are adjusted, taking into account the population distribution and health risk factors in the community, with a view to enhancing public awareness of disease prevention and also their capability in self-management of health. The district health centers also provides individualized primary healthcare services based on personal needs and risk factors for people from different age groups, socioeconomic status, and also health conditions. So far, 2 DHCs have commenced operation in September 2019 and June 2021, respectively. And another 5 DHCs are expected to commence operation in 2022. Meanwhile, interim DHC Express, that is a smaller station, will be set up in the remaining districts within 2021. The government will also issue a comprehensive and sustainable blueprint on primary healthcare development in Hong Kong within this term of government, that is before the end of June 2022. In addition to providing extensive and low-cost public health services, the promotion of a healthy lifestyle and prevention of non-communicable diseases is also key to providing the overall health status of the population. The government seeks to discourage smoking, contain the proliferation of tobacco use, and protect the public from passive smoking to safeguard public health. With the concerted efforts of the Hong Kong SAR government and other stakeholders over the years, smoking prevalence among persons aged 15 and above in Hong Kong has significantly dropped from over 20% in the 1980s to the historical low of around 10% in recent years. Hong Kong has come closer than most countries and regions to the emergence of a tobacco-free generation. The recent passage of the Smoking Public Health Amendment Bill 2019 marks a monumental milestone in the long battle of tobacco control. The full ban of alternative smoking products would prevent these new harmful smoking products from taking root in Hong Kong and creating a new generation of smokers, especially among the youth in Hong Kong. The Hong Kong SAR government has laid down a target of further reducing smoking prevalence to 7.8% by 2025. We will also make reference in exploring the way forward in achieving tobacco endgame goal. Let's talk a little bit about the COVID-19 pandemic and primary healthcare. The COVID-19 pandemic, on the one hand, tests the efficiency and equity of our healthcare system, and on the other hand, manifests Hong Kong whole of society resilient and also mutual help spirit over difficult times. During the epidemic, our primary healthcare system demonstrates the cornerstone function in providing holistic care through coordinated and person-centered manners. Moreover, DHC has actively supported people in need by providing anti-epidemic health education and guidance to the public, making online bookings to receive vaccination for residents, liaising with the private doctors in the vicinity for collaboration in the vaccination drive, distributing specimen bottles for residents of the districts or individuals to undergo COVID-19 testing, and supporting patients who had recovered from COVID-19 with a stabilized condition at the referral of the hospital authority, and that is our public hospital system. Finally, in the long run, the Hong Kong SAR government has proceeded with a comprehensive review on the planning of primary healthcare services and governance framework with a view to formulating a blueprint for the sustainable development of primary healthcare services in Hong Kong. We will make reference to WHO and guidelines, international experience, and primary healthcare policy direction and measures adopted in different places with a view to primary healthcare system that can improve the health of the public and enhance their quality of life. Thank you.
Thank you, Hong Kong, China. New Caledonia, to be followed by Australia. The floor is yours, New Caledonia.
Merci, Monsieur le Président. Chers ministres et invités de marque.
Thank you, Mr. Chair, dear Minister and guest. First of all, would like to thank Dr. Takeshi Kasai and his team for inviting us to the 72nd session for the Regional Committee for Western Pacific, as well as the great welcome by his delegation. We take note of the next session that we hope we can attend also. During the current session, the New Caledonia has been able to show the current challenges that it's facing, just as the neighbors in terms of access to care, the quality and the equity of primary healthcare in the Western Pacific region. In New Caledonia, the primary healthcare is shared between public and private sector. The last one is constituted by health professional of many different backgrounds, is mainly surrounded in Noumea, the capital of New Caledonia. And to compensate these disparities and to ensure sustainable healthcare, the healthcare system is shared throughout the territory with provincial clinics and hospitals. Thanks to this community organization, each inhabitant can access to quality care in less than 30 minutes. Still a bit of equity to access. We have a universal healthcare cover, which covers 97% of the population, and we pay special attention to vulnerable population, chronic patients, or unreached. But this is nothing without the men and women, qualified men and women health workers. That is why the New Caledonia government has been working for many years to develop a human resources strategy nationwide in order to face the lack of health professionals and trying to encourage advanced paramedical training for isolated and remote areas and chronic disease. We've also focused on e-health to strengthen access to primary health care. The COVID-19 pandemic has accelerated, of course, the rollout of e-health, and e-health has been contributed to continuum of care and to sharing medical records. But COVID-19 crisis has also been the occasion to highlight the weaknesses of the healthcare system in New Caledonia and the importance to strengthen the prevention and raising awareness and to coordinate better different professionals. That is why we've launched different initiatives in order to place the patient at the center of the continuum of care. So the patient is not adapting to the healthcare system, but on the contrary, the healthcare system is organized around the patient and their needs. Thanks to this experience, New Caledonia remains convinced of the need to share this experience, and we also want to listen to your own experience, and I'm really happy that we'll be able to share all this experience to move forward further in the health program in the Western Pacific. And on behalf of the New Caledonian government, I thank you for your attention. Thank you, Chair.
Thank you, New Caledonia. Australia to be followed by Tuvalu. Australia, the floor is yours.
Thank you, Chair, and thank you to the panelists for sharing their insightful reflections yesterday. The COVID-19 pandemic has highlighted the importance of building and maintaining robust and resilient health systems, systems that are prepared and can adapt to effectively respond in times of increased demands, while also maintaining core functions and service delivery. It is important to mitigate against disruptions in health services to avoid a resurgence in preventable disease, mortality, and morbidity beyond the pandemic. Primary health care is the cornerstone of a sustainable health system for universal health coverage. This includes access to essential services such as promotive, preventive, curative, rehabilitative services, and palliative care. Australia has a comprehensive health system based on universal access to quality services, supported by Medicare, the Pharmaceutical Benefit Scheme, and an aged care system. We have been able to adjust the way in which primary health care is delivered in response to the pandemic. Telehealth services were significantly and rapidly expanded in order to maintain access to essential health services and are designed to complement face-to-face consultations. This gives patients a choice in the way they wish to receive care, while also supporting vulnerable and less mobile populations to gain and maintain access to essential health services. This has been a revolution in the delivery of primary health care, particularly in rural and remote communities. The pandemic has also demonstrated the importance of considering ways in which the allied health workforce can be better used to support continuity of patient care in primary care settings and to help take the pressure off the acute sector. In Australia, allied health has readily adopted telehealth in response to the pandemic. There are opportunities to explore the learnings from this and extend the capacity for and use of other digital health technologies across the allied health sector. The Australian government is developing a primary health care 10-year plan to drive reform of the primary healthcare system. This includes consideration of a whole of population reform model of voluntary patient registration, which will support a shift from episodic care towards longitudinal, preventative, multidisciplinary, team-based models of care. The plan also aims to address the disconnect and disparities in Australia's healthcare system and to improve equity of access to person-centred, safe and quality healthcare, including tailored services to address health disparities for people in disadvantaged communities. Thank you.
Thank you, Australia. Tuvalu to be followed by Fiji. Tuvalu, the floor is yours.
Thank you, Chairman, for the opportunity. We join other earlier sentiments on the ongoing importance of this issue of primary health care, which I believe also includes skilled health. As existing data indicated, there are high rates of children with obesity among many health issues of concern involving around children, including physical inactivity, smoking, alcohol, poor diet, and stunting. Thus, there is a need to revive this concept in schools as an incubator for health. There's also evidence that showed overweight and other obese children. I believe these are very common issues in our Pacific Island countries. With technical guidance from WHO, Tuvalu was able to implement the health violence concept way back in 1995 as the means of stepping up on our public health or primary health care strategies. Among its other objectives, the Tuvalu Health Violence Program also aims to encourage healthy living habits among our school children through eating healthy local food and more involvement in physical activities and stronger primary health care education to ensure their future healthy lives. Chairman, from our experience in developing and implementing our primary health care programs, we acknowledge the importance of a multi-sectoral strategic approach between the government and its different agencies and departments, the NGO sectors and communities and churches, and the private sector. Recently, we have implemented reducing the consumption of unhealthy food and beverage by raising import charges on unhealthy food and beverage and smoke, and as well as alcohol products. This has been successful in working together with the Ministry of Finance of Tuvalu. There are also strategies to partner up with the Ministry of Education, Youth and Sports to ensure that improving our healthy living habits among our school children. Recently, Mr. Chairman, there was also the Tuvalu National Food Summit, which endorsed a national framework on healthy living through healthy diets sourced from more local food, innovative ways of local food pathways. As you may understand, we in Tuvalu mostly rely on the import of food items. So this national framework will ensure that there is sufficient supply and access for the Tuvalu population to more healthy local food. All these initiatives will certainly support our national public health or primary health care strategy. And of course, there's ongoing importance for us to be depending on the technical and financial assistance from our donors and parties and partners to work together with our government and our people and communities to strengthen our primary health care strategies. Telehealth services, we've also developed our telehealth technology to ensure that we can reach out as much as possible to our outer island communities in delivering healthcare services for them. Mr. Chairman, that's from the update from Tuvalu, and thank you for the opportunity.
Thank you, Tuvalu. Before I give the floor to Fiji, I would like to ask the Pacific Island countries to please put up your hands to speak. This is a true time really dedicated to you considering the time differences. Thank you. I give the floor to Fiji. Fiji, the floor is yours.
I thank you, Honorable Chair, and talofa to you. And bulabinaka to all the delegates that are here. Fiji, in pursuing universal health coverage, believes that primary health care has to be reinforced, and we have to be able to pursue primary health care in the new normal. We have taken on board the strategy put forward by the Ministers of Health in the meeting they had in Yanuda in Fiji in 1995 for a healthy Pacific Islands. And some of those strategies, including healthy settings, is what we've looked at. Before this pandemic came upon us, the new leadership at the Ministry of Health, which includes the Chief Medical Advisor, who's a clinician, orthopedic surgeon, the Permanent Secretary and Obstetrician, and myself, believed that we needed to find ways to reinvigorate our primary healthcare services. Also noting that the SDG goals of 3.0 of universal healthcare. And so we sat down and together with the leadership in the Ministry of Health, we came up with what we believe is the way forward for us, which is called the remodeling of our health services plan. Our intent is to integrate the approach to delivering public health services and our clinical services, strengthen the continuum of care, support the integration of the clinical and public health components that have been strengthened during the COVID-19 response, and provide directions on how health services will be provided, taking into consideration the emerging and the current threats. The guiding principles are 5. It is based on chief. As we all know, in the Pacific, we have chiefs, we have leaders. C stands for comprehensive. We want the services to be comprehensively delivered to the more than 200 health facilities. H for holistic. The ministry recognizes that a Fijian is a communal being and is integral to the community and the nation. This will address the societal and environmental determinants of health. I stands for integrated, meaning the integration of our public health, clinical, curative, mental health, palliative care, which ensure the efficient utilization of our resources. E for enhance. We want to enhance what's currently available, but also the use of digitalization for enhancing the programs that we have. And F, fit for Fiji, meaning that we know what Fiji needs. It is also based on on 6 pillars. The first pillar is governance structure by having divisional command centers. Number 2, the pillar 2 is service delivery. We want to establish integrated outreach program by identifying our hotspots, having an innovative approach, and we collaborated with our general practitioners, and currently we have 17 general practitioners that we use for primary health care. Thirdly, we want to make sure that we have registry and support systems in place, that we effectively track patients, providing more proactive care closer to patients' home, and strengthen reporting based on existing structures, and work towards establishing registries in areas where there are no registry. The fourth pillar is health information and digitalization. We want to keep on improving our health information and digitalization services, strengthen the use of the information system from just a paper-based system, and establish regular monitoring standards across the divisional command centers. 5 is having an enhanced surveillance system. This is not only for COVID-19, but also for climate-sensitive diseases and also for non-communicable diseases. The focus will be on strengthening our current surveillance systems, and we thank our multilateral partners for coming on board. And 6 is our health system strengthening. We want to strengthen and improve the availability of appropriate resources, such as commodities and equipment, align existing human resources to support our remodeling delivery of services, effective methods of resource shifting or resource sharing to support service delivery, and address the operational issues through a collaborative approach, whether it be transport, whether it be mobile clinics, to support movements within the divisions. We believe as a nation, we believe as a ministry, that this is a way forward to us in the new normal of primary health, to be able to achieve the goals of SDG 3.0, which is universal health coverage by 2030. Thank you.
Thank you, Honorable Minister Dr. Wanga from Fiji. Ministers, representatives, delegates, we have to suspend the discussion, and we continue later today at quarter to 3 hours Japan time, to give way to the preparations for the private informal consultations with member states or caucus. Immediately after the caucus, we will proceed with the next item. Suspended. So we suspend now? Honorable Ministers, representatives, the caucus will be starting at 9:30. Honourable Ministers, representatives, welcome back to the resuming of our session this morning. We will now continue our consideration of agenda item 11, that is school health. We took all the member states' interventions yesterday, but did not have time to hear the Secretary to respond. May I now call the Secretary to respond to the point that were made.
Thank you very much, Mr. Chair, and thank you again to all Member States yesterday for your excellent comments and support for this framework. And I also want to say thank you to Member States for all of the input that you provided to the earlier draft of the framework. All of those comments were very well received and helped ensure that the framework we presented to you at this meeting was much stronger product than the earlier draft. I'd also like to acknowledge the support we had from many partners, experts, colleagues in WHO collaborating centres on the development of the framework. Again, all of that expert advice helped to ensure that the product you had before you, I think, was a much stronger one than it otherwise would have been. Mr. Chair, so many excellent Member State comments, I won't attempt to respond to all of them, but there were three key themes or issues that I took out of Member State comments, and I thought I would just address each of those very quickly now. The first was the impact of COVID-19 and specifically school closures on children, on educational outcomes, and the flow-on effects for health outcomes, especially mental health. That came out very strongly from the Member State comments, and we have taken very careful note of that. To us, I think that makes the implementation of this framework even more urgent, and it makes our commitment to implementing the principles in this framework even stronger than it already was. Our RD has been very strongly advocating on the importance of safely reopening schools. He often says it's not a question of if or when we reopen schools, but how we do that and making sure that we do it safely using a risk-based approach. And we will continue to provide any support or advice to Member States on that issue as needed. The second issue that came out, I think, of a lot of Member State interventions was the importance of a tailored approach to implementing this framework, bearing in mind the very diverse country contexts that exist in our region, and indeed the existing approaches to school health that are already in place. We know that we are not starting from a blank slate on this issue. We heard excellent interventions from Fiji, Samoa, Tonga, Laos, Cambodia, Vietnam on the school health programs already in place. And I just want to reiterate that we are obviously seeking to build on what already exists, not to reinvent the wheel. That we don't intend, that the framework is not intended to be prescriptive, but very much our approach to supporting implementation will have a focus on contextualising for different countries, diverse situations, diverse contexts, seeing what works, learning from that, and then scaling up. Again, our RD often talks about the learn and improve approach. Usually he talks about that in the context of health security, but I think that approach is very relevant actually to this context and the implementation of this framework. Australia made some really important points about the importance of taking gender into account in our approach to implementation. We do have a section in the framework on gender, but I think you're right, we need to make sure we have a very strong focus on that in implementation. So that point has been was very well made and has been carefully noted, and we will look at how we can do that. Similarly, Fiji made a really important point that support for implementation, if I understood the point correctly, support for implementation needs to go beyond the kind of traditional, training course model, but also include support for policies and legislation that can help give life to the ideas that are in the framework. And rest assured, we remain very committed to to working with you on that. Korea made the point that there's a very strong role for collaborating centres in the implementation of this framework. We absolutely agree. This region is home to some really outstanding collaborating centres on child and adolescent health and a range of other issues that are relevant to the implementation of this framework. And we very much plan to mobilise our collaborating centre network to support implementation of the framework. The third point, Mr. Chair, or the third theme that I'd like to touch on just very briefly is the link between this framework and NCDs, non-communicable diseases. This framework is not only about NCDs, but it does have a very strong emphasis on NCDs, and that I think reflects the priorities of member states, the importance that we place on NCDs. Of course, that's one of the thematic priorities in our For the Future vision. And I think, again, this was reflected in member state interventions. I think every single member state mentioned something or other related to NCDs, the importance of diet and nutrition. Japan and Mongolia talked about school, healthy diet in school, school meal programs, etc. Physical activity, many member states mentioned the importance of this and the importance of the school environment for encouraging physical activity, and that's something we know we need to do a lot more work on. Almost 90% of children in our region do not get enough physical activity, so we know we need to step up our efforts on that. And then, of course, alcohol and tobacco. Malaysia and Australia very well noted your emphasis on the importance of tobacco and new tobacco products, including electronic nicotine delivery systems. Couldn't agree with you more on the importance of that, and please count on our full support in your efforts to regulate those products and to make sure that our children and adolescents are not using them. With that, Mr. Chair, with your permission, I see that our Assistant Director General from Headquarters, Dr. Naoko Yamamoto, is online. It is very, very early in the morning for her in Geneva, so we really appreciate her being here. But with your permission, I'd like to hand over to her to make some remarks. ADG Yamamoto, over to you.
Thank you very much, and thank you, Mr. Chair, for your permission. Distinguished Member States representative, dear colleagues and friends, since we have had a comprehensive discussion by Member States and the response from the WHO colleague Angela, I would like to add a couple of points on the framework briefly. First, I salute the regional framework on nurturing the resilient and healthy future generation in the Western Pacific. It reframes school from the place focusing only on academic services during enrollment to a center of promoting health and well-being for all in its community. It's a powerful vision and innovative approach. Second, I appreciate its broad scope and integrated approach. It fosters health literacy, values health behaviors to preventing risk factors. NCD, Angela has already said that, but for enjoying long, healthy lives. I also appreciate the emphasis on the broader partnership across sectors to make schools health supportive environment. All students, families, faculties, and staff, as well as community members, have a role to play. It's truly participatory and inclusive. Finally, to develop and sustain the incubators for good health, WHO headquarters, along with UPRO regional office, will provide evidence and data, as well as support for sharing best practice to make intervention valuable. The most important engine to attain the incubator is future community leaders who graduate from schools and leadership with the honorable ministers of the member states. I believe this framework will be the decisive step toward building healthier, safer, fairer world and to foster solidarity. My sincere congratulations to you all, and my respect and appreciation to Dr. Kasai and UPRA colleagues moving this agenda forward. I thank you, Chair.
Thank you, Dr. Yamamoto.
Apologies, Mr. Chair. I was looking to the RD to see if he wanted to speak, but he's saying he's okay, I think.
Yeah, it is okay.
Trying to read the body language, so I think it's back to you, Mr. Chair. Thank you very much. Let me just say thank you very much, ADG Yamamoto, for your very strong support. We look forward to working with your team to support countries in our region to implement this framework. And thank you again for being there so very, very early in your morning. Thank you very much, and back to you, Mr. Vice Chair.
Thank you. Let us give the floor to Dr. Kasai to have his response. Thank you.
Thank you very much, Chair. And thank you very much, ADG Yamamoto. And thank you very much for all the ministers who inspire us and give the advice on how to make this school health, new school health. This school health is no longer its end, but it's a means. And this school health is no longer just schools, but try to use that facility as an infrastructure to serve also the community. And try to make these schools not just a time of the school, but as a part of the lifelong support on health. So it's no longer the old school health, but we wanted to create something very new. And obviously that comes together with the challenge of the implementations. And I'm very much looking forward to work together with the ministers who has those ideas in making this school health as a new initiatives, and looking forward to continue to working with all those ministers. So thank you very much.
Honorable Ministers, thank you, Dr. Pratt, Dr. Yamamoto, and Dr. Kasai for a very good response to the matter that we have discussed. If there are no further comments, may I request the rapporteur to draft an appropriate resolutions. Ministers, that conclude our considerations of these agenda items, and thank you very much. We got to this. Now, shall we move to agenda 12, and that is traditional complementary medicines, documents WPR/RC72/6. I understand the Secretariat has prepared a video to introduce this item. Please play the video.
In the Western Pacific region, communities use traditional and complementary medicine to treat a variety of health conditions. However, its practice varies widely across different countries. For many in remote or underserved areas, traditional and complementary medicine is often the only available and affordable option. However, these services mostly remain outside the health system, and their use is not fully optimized. Strong national policies can promote the key role traditional and complementary medicine plays in improving health and well-being. The regional framework on traditional and complementary medicine aims to harness these services for health and well-being and contribute to improving health outcomes in the Western Pacific region.
Thank you. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the big button on your microphone if you are in the plenary, or by using a raise hand function on Zoom. I can see the Philippines. The floor is yours.
Thank you, Chair. To accelerate the development of traditional and alternative healthcare in the Philippines, the Philippine Institute of Traditional and Alternative Healthcare, shortly called PTAC, was created under Republic Act No. 8423, otherwise known as the Traditional and Alternative Medicine Act of 1997. To implement this function, PTAC has issued various circulars creating guidelines and competency standards for each alternative healthcare modalities. Likewise, traditional and complementary medicine, shortly called T&CM, has been successfully integrated into the healthcare delivery system of 7 government-retained hospitals. While the Institute has formulated guidelines and standards for each practice pursuant to its function, it cannot effectively and fully implement the same, considering the absence of regulatory powers upon PTAC. With proper regulation, the Filipino people can be provided with T&CM health services that are safe, effective, and cost-efficient. Moreover, technical assistance from the WHO is needed in the benchmarking of practices, practitioners, and products towards regulation. With the growing interest in and in the increasing use of T&CM, government intervention is required not only to ensure the safety of the practices, but also to provide the public with the right information on T&CM practices and products in order for the citizenry to make well-informed choices and have better options for healthcare. In response to COVID-19 pandemic, Philippines has prioritized researches on T&CM like the potential use of Euphorbia hirta, Vitex negundo, and virgin coconut oil in the treatment of COVID-19 and the search for antiviral properties. T&CM, as one of the key components of primary health care, can make a significant contribution to the achievement of the goals of UHC, as it might be the only source of health care in underprivileged and hard-to-reach areas of the countries. Therefore, the Philippines strongly endorses the integration of T&CM into the national healthcare delivery system and in UHC in order to prevent diseases and to promote well-being. A resilient population as to the health risk would be beneficial to the economy of any nation. Thank you, Chair.
Thank you, Philippine. May I call the Republic of Korea, followed by Malaysia. The floor is yours, Republic of Korea.
Thank you, Chair. 안녕하세요. The Republic of Korea would like to thank the Regional Office for drafting the regional framework for harnessing traditional and complementary medicine for achieving health and well-being in the Western Pacific. Traditional and complementary medicine plays a valuable role in the health system of many countries and areas in the Western Pacific region, including Korea, and has the potential to play a key role in promoting universal health coverage. However, this potential is not being fully realized in some parts of the region. Korea is certain that the regional framework will greatly contribute to the advancement of traditional and complementary medicine and the promotion of UHC in the Western Pacific region. Korea fully endorses the implementation of the regional framework on traditional and complementary medicine and will support other countries in the implementation of the framework. Korea has put in much policy effort to advance traditional Korean medicine and to integrate it in the mainstream healthcare services. A designated bureau has been established within the Ministry of Health and Welfare, and the comprehensive plan for the promotion and development of traditional Korean medicine has been adopted. The comprehensive plan aims to improve regional communities' health and welfare, strengthen the general primary health care and public health of Korea, elevate the accessibility of traditional Korean medicine, and foster relevant industries. Furthermore, traditional Korean medicine has also contributed in expanding the national health insurance coverage, facilitating the Ministry of Food and Drug Safety's job in pharmaceutical component control and developing Korean medicine clinical practice guideline on the use of traditional Korean medicine, playing a vital role in promoting the health of Korean people. Based on the Korea's experience in the development of traditional Korean medicine, Korea will actively support other member states in policymaking, personnel training, and clinical practice guideline development as they prepare themselves to implement the original framework. As cooperating centers of WHO, Korea's Ministry of Food and Drug Safety and the National Development Institute of Korean Medicine will particularly work harder with the WHO on the advancement of traditional and complementary medicine and the implementation of the framework in the region. The level of advancement in traditional and complementary medicine varies across countries, and based on the social and cultural backgrounds, countries would face different challenges in the implementation of the regional framework. Therefore, the Republic of Korea would like to ask of the countries with the stock policies and industries for traditional and complementary medicine to actively engage and collaborate with other member states in the implementation of the regional framework. Thank you. 감사합니다. 아리가또 고자이마스.
Thank you, Korea. Malaysia to be followed by Brunei. The floor is yours, Malaysia.
Assalamu alaikum wa rahmatullahi wa barakatuh, and very good morning, very good evening. Thank you, Chair. Malaysia recognizes the WHO's effort to maximize the potential of traditional and complementary medicine and in encouraging TCM's contribution to the universal health coverage of member states. Malaysia would like to take this opportunity to convey our gratitude to the WHO for its continuous support to member states in uplifting the profession of TCM. One of the lessons we have learned from the pandemic is the multifaceted nature of wellness. Health systems are rightly moving away from binary healthcare, you are either healthy or sick, to a continuum of care that focuses on prevention and wellness. TCM makes an important contribution here, especially as more people take ownership of their health. For traditional medicine, Malaysia's diverse population from the great civilizations of Asia presents us with an opportunity to draw on the wealth of knowledge and practice from the Malay, Chinese, Indian, Islamic worlds, in addition to our many indigenous communities. For complementary medicine, Malaysia calls for greater focus on complementary medicine like sensory, music therapy, which combines with the allied health services. These therapies not only maintain health over the life course, but are important interventions for rehabilitative care. Malaysia continues to integrate TCM services at all levels of health service delivery in terms of availability and affordability. In order to coexist with modern medicine in the national healthcare system and to contribute optimally towards enhancing the health and quality of life for all Malaysians, Malaysia will ensure that the development of TCM and its practices will be guided by national policies and regulations in force to ensure quality and the safety of the service provision. In addition, the commencement of a national registration of TCM practitioners began in March of this year and is currently ongoing. Malaysia has always been an enthusiastic participant in WHO's efforts to develop and proliferate TCM locally and across borders, as it continues to play an important role not only in healthcare, but also from an economic, especially also socio-cultural perspective. Malaysia supports and is looking forward to embrace and assist in implementing the regional framework for harnessing traditional and complementary medicine for achieving health and well-being in the Western Pacific. Thank you, Chair.
Thank you, Honorable Minister. Brunei to be followed by Laos, PDR. The floor is yours, Brunei.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and very good morning. Mr. Chair, honorable ministers, distinguished delegates, ladies and gentlemen. Whilst Brunei Darussalam's widely accessible and affordable healthcare system is primarily based on conventional or Western medicine, traditional and complementary medicine services is gaining popularity in the country, as seen by the increasing number of registered healthcare or well-being facilities and traditional and complementary medicine practitioners, particularly in the private healthcare sector. In Brunei Darussalam, traditional and complementary medicine is a field that requires further development, especially in terms of national policies and legislation. In this interim period, the Ministry of Health has developed guidelines on traditional and complementary medicine registration and practices, so as to regulate and monitor traditional and complementary medicine services in the country with the primary aim to ensure public safety. This in itself is rather challenging due to the lack of expertise and experience in traditional and complementary medicine within the ministry. Acknowledging the importance of establishing mechanism for the recognition, registration, and regulation of traditional and complementary medicine services to maximize the safe, quality, and effective use of these services to improve health and well-being, Brunei Darussalam fully supports and endorses the draft regional framework for harnessing traditional and complementary medicine for achieving health and well-being in the Western Pacific. We look forward to be working with WHO and other member states in addressing this particular issue in our country. I thank you, Mr. Chair.
Thank you, Brunei. Laos PDR, to be followed by Kiribati. The floor is yours, Laos.
Thank you, Mr. Chairman. In Laos PDR, the role of the traditional medicine is critical and is a long tradition in maintaining well-being and physical health of the population, specifically at primary healthcare level. In remote areas where access to healthcare is limited, during the COVID-19 outbreak, selected products derived from herbal medicine have been often sought in the communities. Thus, the primary healthcare policy highlights its role at the primary healthcare. We also developed the National Strategy on Traditional Medicine 2012-2015. It provides strategic direction for the development of traditional medicine and integration of it into the national health system at the community levels. We have made a good progress in the area, including the development of the first Lao herbal pharmacopoeia published in 2019 and the establishment of the traditional medicine curriculum in the Faculty of Pharmacy, University of Health Science since 2017. However, we still face challenges which include limited training materials in traditional medicine, leading to lack of the qualified traditional medicine practitioner and extinction of medicine plans. Thus, there are a few government factories producing traditional medicine, and also the private factory producing as a product, as a semi-product to export. Most of traditional medicine are produced in household in a small scale. Thus, the regulation of the quality and safety of these products is another key challenge. We believe that the promotion of safe use of traditional medicine for well-being, health promotion and prevention, and treatment will contribute to achieving UHC in our country. To achieve this strengthening health workforce in the area and infrastructure of education and production of quality and safe traditional medicine and regulatory capacity would be critical. Conservation of medicinal plant of Laopedia and traditional medicine knowledge have to be done. And it is not only a country, but a word received. We support endorsement of the draft regional framework for harnessing traditional and complementary medicine for achieving health and well-being in the Western Pacific. I thank you.
Thank you, Laos. Kiribati, to be followed by Japan. The floor is yours, Kiribati.
Thank you, Mr. Chairman, Regional Director, Honourable Ministers and fellow delegates. Kamnaveni Maori, and warm greetings to you all from the people and the government of Kiribati. Traditional and complementary medicines are part of our indigenous knowledge and skills, most of which are unique to certain families. In the use of certain plants, as well as the use of traditional muscle massage therapies for their health added benefits. Harnessing and maximizing opportunities for the integration of these in a manner that is both complementary and symbiotic modern is paramount, with an emphasis on patient safety. Encouraging the use of traditional and complementary medicines is one of the priorities of the government of Kiribati, articulated in our manifesto, and one which we are yet to initiate with our traditional practitioners. I wish to register the keen interest of the government of Kiribati to this forum to pursue the groundwork in the initial steps forward, and we look forward to working with WHO for their support. Harnessing this area of priority will undoubtedly have a positive spin on the economic front through the creation of opportunities for commercialization. We have previously performed preliminary research work in collaboration with investors and the Callaghan Institute in New Zealand into traditional Kiribati medicines. Some of the discoveries, including the antimicrobial properties of the Scaevola ticada plant and the identification of the probiotic microbes within toddy, are but to name a few. This demonstrates the importance of the interface between science and traditional medicines and highlights the importance of evidence-based health practice. As we strive to generate opportunities for our Indigenous practitioners to create health added benefit opportunities to our people, it is most important that we ensure first and foremost that robust processes and mechanisms are in place to guarantee the safety of the public. Ladies and gentlemen, Kiribati fully supports the framework, and we wish to echo both our endorsement and our keen interest to pursue further intervention in this area, exploring novel approaches in our quest for improved patient outcomes. I thank you all, Kambesindaba, and God bless us.
Thank you, Minister. Japan to be followed by Vietnam. The floor is yours, Japan.
Thank you, Mr. Chair. Japan welcomes the draft regional framework. This agenda becomes more important under the current demographic and epidemiological transition of our region, as everybody here recognizes. While every region and every country have its own traditional medicine, perhaps Tuvalu is the region where traditional medicine is most utilized and at the same time most proud of it. Recognizing the further potential of traditional medicine, Japan has built up a platform to accumulate scientific evidence and share this latest information with citizens. We are also keen to learn from other member states and pleased to work through UPLO to share mutual experiences among member states. Thank you, Mr. Chair.
Thank you, Japan. Vietnam to be followed by China. The floor is yours, Vietnam.
Dear Madam Chair, traditional medicine has become an integral part of the healthcare system in Vietnam, spanning across central to local level. Traditional medicine includes traditional medicine hospital at the central and provincial level, and traditional medicine department of general and specialist hospital from the central to the district level. As community health station, traditional medicine is used as selected facility in addition, Vietnam has a system of private traditional medicine practice, including traditional medicine clinics of individual and organization. So, the system of traditional medicine has contributed in important parts in the protection of health of the people of Vietnam. Using traditional medicine for healthcare have been a long-standing traditional culture in Vietnam. The use of traditional medicine for healthcare is community makes it easy for people to access and use. Due to the availability, especially the use of nursing method and massage, acupuncture, breathing exercise, and herbal medicine, which are especially suitable for older people and those with chronic disease. Traditional medicine has helped not only treatment disease, but also in improving the health of the people and preventing them from getting disease. Currently, Vietnam traditional medicine is the official part of the national healthcare system and is covered by health insurance for medical examination and treatment and medicine facilities according to the regulation of the Vietnam government. The COVID-19 pandemic have severely affected all countries, including Vietnam. As part of the measure to fight COVID-19, the Ministry of Health of Vietnam has issued guidelines for using traditional medicine for prevention of COVID-19. Traditional medicine has been used commonly in preventing and treatment to improve the condition of COVID-19 patients in Vietnam. Vietnam supports the draft regulation frameworks for housing traditional and complementary medicine for Asian health and well-being in the Western Pacific. Thank you.
Thank you, Minister. China to be followed by Cambodia. The floor is yours, China.
主席，大家好。中国代表团感谢在推动区域内传统。
Good morning to all of you. The Chinese delegation would like to thank the WIPRO for the actions it has taken to promote the development of traditional and complementary medicine in the region and for its strong support in this regard over the years. China has no objection to the content of the regional framework, and we want to express our appreciation for the timely drafting of this important document by WIPRO, promoting the research and development of traditional and complementary medicine and improving its equitable access while ensuring the quality and safety of the relevant products is an important foundation for the rapid development of traditional and complementary medicine to contribute to the health and well-being of the population, which requires joint regional cooperation and synergistic development. The Chinese government has always attached great importance to this topic. China has signed special T&CM cooperation agreements and established the T&CM Center together with several countries and international organizations. Since the outbreak of COVID-19, T&CM has also played an important role. The participation of T&CM in the treatment of confirmed cases reached 92%, with an overall efficiency of over 90%. T&CM has incorporated into the treatment protocol. China has actively shared our experience and introduced the protocol, sent T&CM experts, and provided T&CM products to countries and regions. At present, the global pandemic is still serious. We are willing to continuously support the work of the region in this regard and intensify international exchange and cooperation, work together to tackle COVID-19 and promote the building of a human health community. Thank you, sir.
Thank you, China. Cambodia to be followed by Mongolia. The floor is yours, Cambodia.
Honorable Chair, Dr. Takashi Kasai, Regional Director, Head of Delegation, ladies and gentlemen. Traditional medicine is being used more widely in Cambodia, and it is still being considered as the important part of in the healthcare system and in the economy as a whole. It was clearly outlined in the National Health Strategic Plan 2016-2020. Since the outbreak of COVID-19, Cambodia has included traditional medicine in the protocol of treatment COVID-19, mainly for symptomatic treatment. The traditional Khmer medicine is predominantly herbal medicine with minimal use of animal and mineral remedy, and extent include the use of massage and acupuncture. National Center for Traditional Medicine under the Ministry of Health to provide leadership and governance on traditional medicine policy and strategy and implementation. Some policy and strategy documents were developed and need to be updated and aligned with the regional action framework. The traditional medicine policy of the Kingdom of Cambodia was endorsed in October 2010. It is used as the reference guide for the implementation and management of traditional medicine in the country. This policy covers the practice of traditional medicine, training and education, regulation, research, and national and international cooperation in traditional medicine. The Traditional Medicine Strategic Plan 2012-2020 was approved. One of these objectives is the inclusion of traditional medicine in the national health medicine while assuring the safety and quality of practice and the product. A progress has been made on the implementation of this policy and strategic plan with support of WHO and other agencies. We acknowledge that more need to be updated in incorporate new suggested way in which traditional and complementary medicine can potentially play a larger role in improving health and well-being, preventing disease, and managing long-term chronic conditions at the primary healthcare level. I do trust that the regional action framework for traditional and complementary medicine in the Western Pacific would guide member states, including Cambodia, to fulfill this need. Thank you.
Thank you, Minister. Since Mongolia has put their hands down, I'll give the floor to United States to be followed by New Zealand. United States, the floor is yours.
Thank you, Chair. The United States thanks the Secretariat for the report on traditional and complementary medicine and for their work to develop the draft regional framework for harnessing traditional and complementary medicine for achieving health and well-being in the Western Pacific. We welcome the framework's emphasis on safe, effective, evidence-based, and quality-assured practices for the promotion of health and well-being and support the draft's 4 strategic action areas. The framework acknowledges the lack of or gaps in scientific evidence as important obstacles that member states face in developing policies and regulations, increasing effectiveness of T&CM. The framework also supports evidence-based medicine and recognizes the importance of rigorous scientific research and regulatory and quality assurance guidelines and standards as critical cornerstones for the safety, efficacy, and quality of traditional and complementary medicine. We thank the Secretariat for this draft framework, and we look forward to learning about continued progress in the coming years in strengthening traditional and complementary medicine policy and supportive regulatory and educational systems towards our shared goals for public health and well-being. Thank you.
Thank you, United States of America. New Zealand to be followed by Hong Kong, China. The floor is yours, New Zealand.
Ngā mihi nui. Thank you, Mr. Chairman. New Zealand welcomes the draft regional framework. Like many countries in the region, there is growing interest in New Zealand in integrating Indigenous concepts of well-being into the health system to achieve equitable health outcomes for our communities. We know that while the Western paradigm of medicine is primarily focused on responding once a health issue has occurred. In contrast, Rongoa Māori, which is a body of traditional medicinal practices from the Indigenous peoples of New Zealand, provides a very important understanding of the events that lead to ill health through culturally bounded responses. In this regard, traditional and complementary medicine is not just a way of dealing with health and wellness issues, it is also an expression of culture, of who people are and where they belong. As such, New Zealand's work in this area involves close collaboration with Māori and adherence to Te Tiriti o Waitangi, New Zealand's founding document, which is based on the partnerships and participation, as well as Māori self-determination, equity, active protection and options. In 2020, the New Zealand Ministry of Health released Whakamoa, the Māori Health Action Plan for 2020 to 2025. One of the plan's goals is to expand access to rongoa Māori by developing the workforce. We have commissioned a review of the rongoa Māori sector, the findings and recommendations from which will be instrumental in integrating these holistic practices into mainstream health services. In addition, the ministry currently funds around 30 rongoa providers across the country, and we have re-established a partnership with Te Kahui Rongoa Trust to co-design work programs that protect, nurture and promote rongoa Māori. We have also put in place a new contract cycle for these services over the next few years to ensure that the sector can continue to grow in the face of challenges such as COVID-19, and also noting the wider health and disability system reforms that will be undergoing in New Zealand. I will finish by emphasising that at the core of traditional and complementary medicine is the right of Indigenous peoples to define their own practices and beliefs. New Zealand thanks the Western Pacific Regional Office for its work to support traditional and complementary medicine as a core pillar of our efforts to be the safest and healthiest region. Thank you.
Thank you, New Zealand Aotearoa. Hong Kong, China, to be followed by Vanuatu. The floor is yours, Hong Kong, China.
Thank you, Mr. Chairman. Regional Director Dr. Kasai, honorable ministers and fellow delegates. Hong Kong, China would like to express our appreciation for the excellent effort of WHO in the formulation and implementation of strategies for advancing traditional and complementary medicine to play a key role in promoting people's health and well-being in the Western Pacific region. Traditional Chinese medicine had long been used in Hong Kong community and is already an integral part of the Chinese culture here. We have passed the Chinese Medicine Ordinance since the 1990s and has put in place a well-established comprehensive regulatory system so as to ensure the safety, quality, and efficacy of all forms of Chinese medicines, as well as the Chinese medicine practice. Hong Kong, China is also fully committed to incorporate the Chinese medicine service into the local health system so as to enhance the affordability, accessibility, and acceptability of the Chinese medicine use for the citizens. In our latest policy address issued last month, the government has announced the commissioning of the first dedicated Chinese medicine hospital, so to provide and expand our service provision to cover primary, secondary, and tertiary care. setting up of the Chinese Medicine Testing Institute to support research and innovation in Chinese medicine, and various other initiatives to support the long-term development of the Chinese medicine sector. Being a WHO collaborating center for traditional medicines, the Department of Health, Hong Kong, China has a mission to provide support to the WHO on the development of the international herbal pharmacopoeia, capacity building for the experts, testing of Chinese medicine, and as well as implementation of the WHO Traditional Medicine Strategy 2014 to 2023. Mr. Chairman, Hong Kong, China would be pleased to join the other member states to endorse the regional framework for harnessing the T&CM for achieving health and well-being in this region. We believe this would help to promote use of traditional medicine to approach and attain community-oriented approach to health in the region. And we look forward to working with other member states in this regard. Thank you.
Thank you, Hong Kong, China. Vanuatu to be followed by Mongolia. The floor is yours, Vanuatu.
Thank you, Chair. Traditional medicine or custom medicine known in Vanuatu, provided by traditional healers, still is extensively used throughout Vanuatu, although it is practiced outside the formal regulation. This can be the result of relatively low accessibility to Western healthcare services in terms of both finance and distance in comparison to the easy accessibility to the custom medicine services, which is available in both rural and urban areas. In most of rural or traditional communities, traditional medicine is taken and believed to be part of primary healthcare and used as first aid and to supplement modern medicine. In National Medicine Policy 2015 to 2030, herbal medicines and traditional medicines are recognized as medicines along with biological and vaccines. Vanuatu 2030, the People's Plan, National Sustainable Development Plan, 2016 to 2030, has set preserving and enhancing cultural and traditional knowledge, including appropriate medicines, natural remedies, and healing practices as one of the policy objectives to maintain a vibrant cultural identity of its people. It is especially notable in reproductive health and that would collaborate with traditional birth attendants to encourage mothers to deliver in health facilities. And as other speakers have said, Vanuatu will cooperate and endorse any legal framework with other member states to enhance and promote traditional medicines. Thank you.
Thank you, Minister. Mongolia to be followed by Samoa. The floor is yours, Mongolia.
Thank you, Mr. Chairperson, for allowing me to speak. Earlier, our connection was lost and we had to reconnect to the platform. Mr. Chair, traditional and complementary medicine in Mongolia has been incorporated into our national strategies for contributing to the modern medicine in the areas of chronic disease management and promoting good health and general well-being. Traditional and complementary medicines play an important role in the delivery of the medical services in Mongolia, especially in the primary healthcare and rehabilitation services. The state policy on health and the government action plan for 2020 through 2024 has several objectives to develop and strengthen traditional and complementary medicine in the country. The long-term state policy on health has defined two strategically important objectives related to strengthening traditional Mongolian medicine, which include, number one, developing traditional medicine diagnostics and treatment alongside modern medicine at primary and referral levels of healthcare, and number two, supporting the manufacturing and export of traditional Mongolian medicines of plant, animal, and mineral origin. The traditional and complementary medicine providers practice both in the private and public sectors in outpatient clinics, general hospitals, and sanatoriums. Some tertiary level hospitals have traditional medicine ward, and the traditional medicine inpatient services and sanatoriums are funded by the health insurance fund if they meet the health insurance selection criteria, including the accreditation. Currently, the WHO country office is providing technical and financial support to assess the country's current situation of traditional medicine, including the revision of policies and legal framework, human resources, service delivery, customer expectation, and satisfaction. The assessment results will soon be discussed and used for decision and evidence-based policy making. Mr. Chair, there is a need to strengthen research capacity and collaboration between countries in the region, which generates scientific evidences for using traditional and complementary medicine in the prevention, management, and treatment of chronic disease. We believe the regional framework will be the basis of continued attention to strengthening culturally and context-specific regulatory systems to ensure safety and quality of traditional and complementary medicine. On this note, Mongolia welcomes the endorsement of the draft regional framework for harnessing traditional and complementary medicine for achieving health and well-being in the Western Pacific region. Thank you.
Thank you, Mongolia. Our next speaker is Samoa. The floor is yours, Samoa.
Thank you, Mr. Chairman. Regional Director, Excellencies, ladies and gentlemen, Samoa wishes to commend WHO for their commitment and leadership in developing this regional framework for harnessing traditional and complementary medicine for achieving health and well-being in the Western Pacific. The Samoa government fully supports the endorsement of the aforementioned regional framework, which articulates the contribution of traditional and complementary medicine for achieving the vision set out for the Western Pacific region to become the healthiest and safest region for the future. We support the strategic areas that are considered for this framework, such as promoting the role of traditional and complementary medicine for health and well-being through national policies, strengthening context-specific mechanisms to ensure the safety, quality, and effectiveness of traditional and complementary services, increasing coverage and equitable access to safe and effective traditional complementary medicine services, and supporting documentation, research, and innovation for traditional and complementary medicine services. Currently, Samoa has moved to registering all the traditional birth attendants and providing annual credentialing program under the Nursing Integrated Services Division. They are also provided with the delivery kits for safety, deliveries of home births, and for infection control purposes. This is to ensure the practices and services they provide for the population are safe and secured through effective monitoring of the traditional birth attendants guideline. As a way forward, Samoa will move to strengthen health advocacy and educational programs to increase the knowledge and build the capacity of traditional birth attendants in providing quality and safe maternal health services in the community. These developments, we believe, can contribute to implementation of this framework in harnessing traditional and complementary medicine as another option for the terminal patients, especially the terminal cancer cases. We look forward to WHO's guidance and leadership to continue to strengthen this framework as we move forward. Thank you, Mr. Chairman.
Thank you, Samoa. Our next speaker is Federated State of Micronesia. The floor is yours.
Thank you, Mr. Chairman, and our humble respect to all honorable ministers and delegates. FSM acknowledges the important role traditional and complementary medicine plays in the lives of our people. T&CM is practiced on a daily basis in our country at different wavelengths and among and within our community members. In our context, there is a great need to harmonize policies, regulations, and the system in which T&CM can be safely and effectively improve the well-being of our people. As a means for the FSM to have a mature framework, FSM endorses the regional framework on traditional and complementary medicine. Thank you, Mr. Chairman.
Thank you, Federated State of Micronesia. Ministers, are there any more representatives who wish to speak on this topic? If not, I understand that the following non-state actor has submitted a video statement to the committee on this agenda item. The World Federation of Acupuncture and Vaccination Society. Let's play the video, please.
Ladies and gentlemen, at the 140 Executive Committee meeting held in Geneva, Switzerland 2017, WAFAS proposed to recommend that the World Health Organization to include acupuncture in emergency medical service. Today, the World Federation of Acupuncture and Vaccination Society, WAFAS, still advocates that acupuncture has its effect in the treatment of many emergencies. The World Health Organization has issued acupuncture guidelines for treating or relieving 64 different symptoms. Acupuncture has proven to be particularly effective in relieving pain and anxiety. Therefore, in emergency medical service, we recommend the use of acupuncture to relieve symptoms such as pain, tension, depression, anxiety, and insomnia. Hence, this is something more meaningful to the World Health Organization. When a crisis or certain disaster occurs in a region, WAFAS has a very close relationship with the World Health Organization. We can cooperate together with the World Health Organization to send qualified acupuncturists and doctors to serve as an emergency medical team and to provide support in the spirit of the World Health Organization humanitarian assistance. Finally, as a qualified acupuncture doctor, I'm responsible to reconfirm that acupuncture is a safe treatment method. In the report of many years of clinical experience, it is rarely reported that acupuncture treatment causes any side effect. In terms of the effectiveness of treating disease, we have quite a number of international papers confirming it is clinical effect. Today, we are presenting this policy proposal at the World Health Organization Western Pacific Regional Conference in the hope of gaining actual recognition and promoting acupuncture in emergency medical service in the region and also to the whole world.
Thank you very much. All written video statements from non-state actors and observers on this agenda item will be uploaded to the RCM. web page. As statement reflects solely the views of the NGO concerned, it follows that statements do not necessarily reflect the view of the World Health Organization, including its member states and secretariat. May I now call on the secretariat to respond to the points that have been made. Mr. Martin Taylor, the Director, Health Systems and Services, will respond.
Thank you very much, Chairperson. And first of all, let me express our appreciation to all the member states who have shared in their interventions today, but all the more so for those who contributed to the development of this framework in the consultations that we held in the course of developing the framework. There have been many, many really helpful and important points shared today, so I will just highlight a few of the key ones. First of all, we heard from many member states how traditional and complementary medicines are rooted in indigenous cultures and practices, and that is an incredibly important part of understanding how these medicines are developed and applied. Secondly, we heard a number of member states reaffirming the potential role of TCM in achieving universal health coverage, and in particular the contribution to promoting health and wellness in terms of also preventing ill health. Linked with that, but following from that, we heard a number of member states talk about the demographic shift, non-communicable diseases, and the importance of TCM in managing chronic conditions, in palliative care, and in rehabilitation. We heard a number of member states share the excellent work that they have been undertaking to ensure safety, quality, and effectiveness of TCM products and services, and the need to continue to do more so. We also heard from a number of member states around the role that TCM has played and its importance most recently during the COVID outbreak in terms of our understanding of a broader understanding of health and wellness and the importance of TCM in that, in rehabilitation, and also in symptomatic and management and care of COVID-19 patients. Lastly, and just to conclude the summary, we've heard from a number of member states the important work that is being undertaken in terms of research, development, and development of evidence and the dissemination of evidence, and the need to continue this and to continue strengthening capacity for this across the region. And then finally, that a number of member states shared their willingness to share their examples with other member states and to participate in experience sharing across the region. That concludes the brief summary, Chair. We look forward to continue working with member states on TCM.
Thank you, Mr. Taylor. Before we break for coffee, may I call on the Director, Administrations and Finance for the administrative announcement.
Thank you very much, Mr. Chair. It's a busy day, and we have a couple things we just want to remind people of. First off, on the way to coffee break, please take a minute to sign the thank you boards in the foyer if you haven't had a chance up till now. We'd really love to have everyone in the room show our appreciation to our hosts through signing the thank you boards. Again, we will break for lunch at 1:30, and apologies again that we only have 20 minutes for that before the session starts, the side event on mental health, which starts at 1:50. After the side event at 2:45, there will be a resumption of the panel discussion on primary health care for those who have not yet had a chance to join the discussion. And then after that session today at 3:45, there will be a virtual excursion starting at 3:45, and it will be held on the same link you're on now and in the plenary hall here. This is a very interesting live virtual tour of local Himeji and Hyogo Prefecture health services, and the program will allow for live interaction with local practitioners. So you are warmly welcome to join that session as well. At the same time, that starts the rapporteurs meeting, will again be held at 3:45 in room 408. And then one more note on today. For those here, dinner tonight is self-pay from 6:30 to 8:30 in the Belvedere room, the 3rd floor of the hotel. And tonight's theme is the Autumn Japanese Festival, so it should be a very interesting meal. And finally, tomorrow, the first session will again start at 7:45, and we'll be talking about agenda items 15.2, WHO reform and work in the countries, and 15.3, items recommended by the World Health Assembly and the Executive Board on sustainable financing. And like today's panel discussion on primary health care, there are plenary discussions. These plenary discussions have been split into two to allow for more favorable time zone coverage. So although you're warmly welcome to join both sessions, joining one session is also an option, and the discussions and interventions will be brought together for conclusion in Friday's session. So the final discussion in the plenary will happen on Friday. Thank you, Mr. Chair.
Thank you, Mr. Kopasa. We will still have we have our mobility break. I understand it will be led by Chinese delegations through a video. May I ask everyone to please stand up, switch your camera on, and join in. For those in preliminary, may we request everyone to maintain safe distance. Honorable Ministers, this reminds me that I have to close this session regarding the TCM. Then read this one. If there are no further comments, may I request the rapporteur to draft an appropriate resolutions. That concludes our considerations of these agenda items, and thank you very much. Enjoy the day.
One me got right for play sports. Me no save do him one way me do him today. Sports me no got support.
Recording stopped.
Vanuatu, especially as one woman, okata blow house, okata blow kitchen, blow cook, blow wash, look out in pikinini. But na blow me very important lo me. Him save support me lo day one kasem now ya. Him look out in pikinini, make him say me save continue blow make him one way me love him. Me one mama blow 2 boys and I'm already 42. Me still feel very strong. Sport chemicals one medicine blow body from me. It making me stop fetal time. Mentally too, me feel him and me helping me build him confidence. Now yeah, me have start him on one business blow me lo side the fitness industry and me want something where me never think about me make him same full up mama lo Vanuatu only no exercise. Me go gym me no look one mama. And me want fitness exercise and me Zumba and me put them out all mama only come me fly exercise and then only like it because sambala we first time only come only sagat knee pain only sagat back pain so only come try and me ask him all get how only feel only say knee so he loose back pain he loose only feel more relaxed only feeling good. That's why I only come every time. Me want them continue blow me stop healthy and continue blow making exercise as long as me still alive and well me continue blow live healthy lifestyle.
今天是他感染的第3天。大家好，我是海棠，一名影视摄影师。我老婆叫李婷，一名医院急诊科的护士。我希望通过这个视频来记录我们抗击肺炎的点点滴滴。每次全副武装进入他的房间。刚量了，量烧没有？有了。家里的每一个地方也都要消毒，让病毒无处可跑。该吃的吃啊！做好他爱吃的每一个菜，补充营养，希望他有充沛的体力去打败病毒。没事，我就在里头啊，不出去了。我要你在里面。你不出来。所以我们准备今天去医院复查。怎么样，老师？他有问题吧？
老师怎么样了？可能有问题。
还是有问题的。医生说 CT 片子上面显示感染有加重，住院治疗是我们现在最好的选择了。
我觉得我的身体太大了，我觉得身体都太大了。老婆，你后不后悔跟我结婚？
不后悔，我一点都不后悔。
你后悔？
我不后悔，我一点都不后悔，真的。我很幸福啊。
你后悔？
后悔？
我真不后悔，我后悔没有早点认识你。我和儿子在等着他的痊愈。
我老婆明天终于要出院了，然后我现在特别兴奋，真的是很开心，就是太开心了，太煎熬了，真的是太煎熬了。然后真的是这段时间，我感觉所有的努力也没有白费，然后终于快熬到了这一天了，真的是太开心了，很开心现在。
你也亲一口爸爸，亲一口爸爸。你赶快给你。
这段生死的历程，在我们的生命里刻下了一道深刻的印记。
未来，我希望我们都能好好的。我希望石头长大了，能记住这一年，记住他的妈妈受过的苦难，记住那些为疫情付出的人们。
你现在身体怎么样？
好得很呢，不然你为什么要我做卫生呢？一回来就。
我没有要你做卫生，是你自己回来，这里有搞那里有搞。
Na ol tokimi o se em gati poli. Ndam do ko pa. Mo se baby. Em no sana sit down kayetu. Em mitla sta 6 months or 5 months kai musi. Au sikia mitla goya. Every Wednesday mitla goya. Also tokimi lo. Avinu mi mas. Boiling water, morning, afternoon, me boiling now. Put it on leg.
Hello. I'm sure it works.
Me worry. Me sinti dobla sinti. Me cry. Me oklo pray lo Papa God bless by helping me. Sani si pikinini blend o karime me go. Bam ko suicide the most to car. Mita milas the amba kizi. This la sick cripple nemba sta kwantemi because me no karim this la kan pikinini. Me oklo boiling water. Womi hand blame black blogger. Making me go na. Emoklo crawl o sem baby. Crawl libo. Me tired and you exercise me. So night me tla no sa chili. Me tla sa exercise me. Igo. And start em crawl wrong. Me oklo pray lo God that's all me continue me pray here. The big man help this la pikinini. Em stand up inside the house me the sister them me tla stand up and holy hand like me. Em walk about igo. Na me talk thank you na me big mouth na me cry. Toko sa mi mama blog gafo. Mi toko sem. A ver dol mas kisim nisla drop. Em no kisim so em kisim nisla sick. Em man blogo. Em sa helping me. Em baka sit down helping me. When em leave walk me em mas come helping me. Em baka clean me sweat do me. Em sa helping me good.
あの時私は孤独でした。高校時代の私は自ら命を絶つことも考え、一人苦しんでいました。後に私は信頼できる恩師に奇跡的に出会えたことで問題を乗り越えられました。 問題を抱えた人が奇跡や運や偶然でしか僕にとっての先生のような頼れる人と出会えないというそういう環境はおかしいと。問題を抱えた人が確実に頼れる人にアクセスできるような仕組みを作り、望まない孤独を抱えることがないように我々はあなたの場所というのを立ち上げました。あなたの場所は24時間365日誰でも無料匿名で利用できるチャット相談の窓口になります。私たちにアクセスをしてくださる方のほとんどが29歳以下の子供や若者たちになります。メンタルヘルスに悩む多くの人に共通している課題は孤独を抱えているということです。友達や家族は近くにいるけど相談できない、頼りたくても頼れないという状況にあります。私たちのミッションはこうした状況をなくすこと、つまり望まない孤独をなくすということになります。私たちはまずは話を聞いて、そして自分の気持ちに寄り添ってもらえる場所がある、自分は一人ではないというふうに感じてもらうことが大切だというふうに考えています。間違いなくこのコロナによって人々のメンタルヘルスというのは大きな影響を受けたと思います。実際にデータを見てみると顕著で、特に子供や若者、そして女性が影響を受けています。ただパンデミックによってメンタルヘルスに対する考え方というのは大きく変わったと思います。例えば、このパンデミックの中で、多くの人がメンタルヘルスの問題を抱えているということは、社会に広く知られるようになってきました。僕自身は望まない孤独をなくしたいと思って今この活動をしていて、相談師さんと日々接している中で、その相談師さんが抱える本当に苦しみというのがよくわかるんですよね。自分自身もそうだったので、孤独対策をやろうと言って少しずつ社会が動いてきたと思います。若者が自分の言いたいこととかやりたいことを言ったとしてもそれが認められないっていうふうに言われてますけど、しっかり理由があって、そしてどういう社会を築いていきたいのかっていうビジョンを示すことができれば、学生であっても若者であっても少しずつかもしれないけれども社会を動かしていけるというのはこの経験から学んだことですね。
เราต้องเตรียมพร้อมบ่ว่าจะเป็นตอนสายตอนเช้าตอนสายหรือว่าตอนกลางคืนเนาะสำหรับสุขศาลาเฮามันก็แม่นอยู่เขตห่างไกลเนาะถ้าว่ามีคนเจ็บมาก็พร้อมที่ว่าจะช่วยเขาเจ้าเฮาเฮ็ดเวียกอยู่กับชุมชนมันจะมีความสุขแล้วก็มีความภูมิใจหลายกว่าอันถ้ามารู้สึกเมื่อยบ่ก็บางครั้งก็เมื่อยเนาะแต่ว่าเฮาเฮ็ดไปแล้วที่ว่าเฮาซอยไปแล้วเนาะเห็นเด็กน้อยกับแม่แข็งแรงคือว่ามีความสุขแล้วลืมไปเลยมีกรณีนึงเนาะที่ว่ามาเกิดลูกเนาะในเบื้องต้นที่ว่าปกติทุกอย่างเนาะหลังจากเล็กออกแล้ววันนี้แฮบ่โคเนาะแฮบ่โคแล้วเฮาก็เฮ็ดนวดมดลูกแล้วแต่ว่าแฮก็ยังบ่โคแล้วเฮาก็รู้สึกทั้งย้านแล้วก็ประสบการณ์เฮาก็แบบว่าบ่เคยเจอสักเทื่อเนาะจากสุขศาลาเฮาไปหาโรงหมอก็60กว่ากิโลสำหรับสุขศาลาเฮามันบ่มีเนาะมีแต่เดี๋ยวนี้มีแต่อันคืออ้ายมันเป็นอันจบพยาบาลคือน้องพลุงคันมี2คนด้วยแล้วก็ทางญาติแน่แต่ว่าก็พยายามเฮ็ดสุดความสามารถได้อันใส่ถุงมือยาวเพราะว่าจกเอาแฮออกแล้วหลังจากเฮาปฏิบัติแนวนั้นแล้วก็แม่ก็ปลอดภัยถ้าว่าบ่มาเกิดอยู่สุขศาลาก็คิดว่าน่าจะบ่รอดเนาะรู้สึกภูมิใจที่สุดด้วยความรู้สึกของเฮาณตอนนั้นน่ะก็คือว่าเฮาช่วยชีวิตคนคนหนึงได้เนาะแล้วเฮาก็สิพยายามแบบช่วยต่อไปเรื่อยๆย้อนว่าเฮาลงไปเนาะมักที่สุดเลย เขาแบบเหมือนแบบว่าถือเป็นกันเองเนาะ
Recording in progress.
ครอบครัวกล้าเว้ากล้าว่ากล้าปรึกษาคือว่าตัดสินใจแล้วว่าจะเฮ็ดเวียกอยู่นำชุมชนตลอดไป
Анхны үүрэг гүйцэтгэх хугацаанд би өөрийн гар дээр эмээг алдлаа. Анх бүр огтой ганц ангил гэдэг цэргийн төвөмлөгийн эрчим тэмцэлгээний хэмж дэслэг цалтай. Манай эмээ тийм биеийн байдал нь жоохон доктортой гайгүй байх үедээ би сайн байна. Одоо гэртээ гарна. Миний хөө мундаг сайн ажиллаж ийн гэж амьдралынхаа эцсийн мөч хүртэл бас тэмцэжсэн явдал доорлоод татсан санагддаг та. Саяны сүүлийн үүрэг гүйцэтгэлээр нэг өдрийн дотор нэг цагийн дотор 3 хүнээс иржсэн тохиолдол гарсан. Бид бүхний нүдэнд бол тэр 3 хүний ар гэрийнхэн өөр хүүхдүүд нь ач зээнэр нь л ер нь бидний нүдэнд харагддаг. Яаж ар гэрт нь одоо би юм байдал нь ийм байсан одоо ийм болоод өнгөрчлөө гэдэг юм уу тэр талаар мэдээлэл дуулах их хэцүү. Тэгээд одоо үүрэг гүйцэтгэж явах үедээ тэр нь бол одоо миний эмээгээс өрцөхгүй миний өвөөгөөс өрцөхгүй гэж ер нь бол миний ойр дотны хүн шиг л одоо бүх хүмүүс харагддаг учраас тэдний хаймнасыг нь аврахын тулд бид бүхэн ер нь өдөр шөнөг бол өөрийгөө гүйцэтгээд өргөсөн тагарахтай хүнчээр зүтгэж явж байна. Хүмүүсийн ер нь биеийн байдал сайжраад эмнэлгээс гараад хөл дээрээ бусаад гарч исэн тохиолдолд бол зөндөө байгаа. Тэр хүмүүсийн гарахтаа баярлаа гэж хэлж байгаа үг нь л ер нь одоо л миний сэтгэл санаанд их тод идэг. Туртайгаа зэрэх юм бол зайсан толгой дээр нар жаргах цагаар гарч хотын байдлыг харах. Зайсан толгой дээр гараад зогсоход нэг сэтгэл уужраад уушиг тэлэгдээд ингээл дотроосоо их тайвширлыг л мэдэрдэг. Хөл хорооны байдалтай холбоотойгоор л манай найзууд сүүлийн хэдэн сар ер нь уулзлах байгаа. Тэгээ бид бүхэн одоо хоорондоо таарах магадлал хомс ер нь байхгүй болсон. Тэгээ одоогоор ингээд 100 гаруй насаар л ингээд гарчаад байгаа. Энэ чигээр ингээд энэ тоон дээр ард иргэд хүн бүхэн мэргэжлийн байгууллагаас гарч байгаа тэр заавар зөвлөмж гэдэг юм л заашгүй биелүүлэх шаардлагатай байна. Энэ вакцин гэдэг зүйлтэй хүн болгон л идэвхтэй хамрах тасаа гэж хүсэж байна.
Gulat kami bakit nauso dito yung tigdas dito sa amin. Nag-umpisa po noon sa taas po namin nakatira. Tapos po sa katabi rin po namin nagkatigdas. Tapos yung anak ko pong 3, ayun po, kawawa na po. Bali, ang pamilya ko po malaki, marami po akong anak. Yung anak ko po, 7, anak ko po, yung mga kumpleto po bakuna. Bali, 3 lang po. Ayun, hindi na po napabakunahan. Yung 3 po, yun. Yun talaga po yung mga nagkatigdas. Nung bali po nung kasama po yung tatay ko, ayun po, medyo nakakaliwa kasi nakapaghanap buhay po ako. Bali, tatay ko nagbabantay. Ito lang talaga na wala lang din tatay ko. Wala magbabantay sa mga anak ko. Ayun lang po, di na ako nakapagpadala sa center. 9 months po yung baby ko. Tapos sumunod po, 3 years old, tsaka 4 years old po. Nung nagkatigdas po. Una nilalagdas, may ubo po. Tapos nakita ko po pamumula na po sa katawan nila. Tapos mga ilang araw, naging itim na. Kasi dumami na sila ng dumami. Lagnat lang po talaga yung binabantayan ko kasi yung pinakakatakot. Yung mag-convulsion, sabay-sabay po sila, 3. Doon po ako natatakot kasi umiyak lang. Hindi ko alam kung ano yung nararamdaman po nila. Kaya natatakot ako. Anong masakit sa nila, tanong ko ng gano'n. Wala, iyak ko lang. Naawa po yung mga kapatid niya po. Sabi nga ng anak ko po, ba't di pa dali sa ospital? Kasi nga yung natakot nga rin anak ko po. Sabi ko, paano ko dadalhin? Walang magbabantay sa ibang kapatid mo. Pumayat po talaga sila, natuyot yung balat, halos ayaw kumain. Sabi ko, kung pwede lang, balikan talaga. Sisisi rin din po kasi ako nun. Kung napabakuna ako po talaga, hindi sana magkakagal yung mga anak ko. Nakayanan din po sa awa po ng Diyos. Siguro pa mga 5 araw, 4 na araw yun, nakakain na po sila. Okay na po sila. Normal na po. Yung panganay po na apo ko po.
Honorable Ministers, welcome back from the coffee break. We will now move to begin our considerations of agenda item 15, specifically 15.2, WHO reforms, in brackets, WHO's work in countries, close bracket, and 15.3, items recommended by the World Health Assembly and the Executive Board, in bracket, focusing on sustainable financing, which is referred to documents WPR/RC72/9 and documents RC72/INF/4. As mentioned on Monday, item 15.2 and a part of item 15.3 relating to sustainable financing will be taken up together. We will take interventions on these topics in the core hours for different time zones tomorrow morning and tomorrow afternoon. To begin, may I call on the Regional Director to make some remarks and the Director of Program Management to introduce these agenda items.
Thank you very much, Honourable Ministers, Mr. Vice Chairperson. Good morning and good afternoon, Honourable Ministers and distinguished delegates. I would like to make some brief remarks about why we are combining our sessions on WHO work in countries with the discussion on sustainable financing today. Before I hand over to the DPM to explain the more detail, she's going to explain some more detail the mechanics of how the sessions will work. Now, as all of you know, 2 years ago, member states of our region unanimously endorsed the For the Future vision to guide the WHO work in the region in the coming years. It articulates the goal of acting today to address the health challenges of tomorrow. And in order to make the Western Pacific region the safest and healthiest regions in the world. And this vision builds on a long-standing practice established by my predecessor, Dr. Shin-Yeon Soo, of putting countries at the center of our work. He always emphasized, unless WHO can make changes happen on the ground, we're not really delivering the output. And linked to this practice, we now have a well-established tradition at the RCM of including a session of WHO work in the countries in the region. So we present what kind of work we do, and then they receive advice from the member states. And we have a 15-country office in the regions, and our strong practice of the regional office and country office working together as one team. And many of our country office staff are very excited to be joining these sessions virtually today. Let's say hello to all of them. Oh, good morning or good afternoon or good evening, whichever. I don't know what technology you're using this, but very good. Hi, good morning or good afternoon. Oh, that's a Philippine country office. That's Malaysia, China. Thank you very much. Now, let me explain why we are combining our sessions on the work in countries with the discussion on sustainable financing. The reason is simple. Sustainable financing is critically important for WHO to be effective at the country level, as the examples you will see later in these sessions help to demonstrate. The question on how best to sustainably financing WHO's work is a long-standing one, and there have been many discussions over the last decades and more, but no successful resolution to date. Yet the COVID-19 pandemic has highlighted the flaws in WHO's current model of financing. And this is why WHO Executive Board established the Sustainable Financing Working Group earlier this year. And I would really like to thank the chair of the working group, Mr. Björn Kummel of Germany, who you will hear from shortly, and for your leadership of the working group. And I would also like to thank Australia for all of your efforts to represent the interest of our region during these deliberations. Now I would like to hand over to DPM to briefly explain how our session will work today. DPM, please.
Thank you very much, Ardi, for setting the scene. So today we will hear about the work of the working group on sustainable financing. As the regional director said, we will hear from Björn Kummel, the chair of the working group, who will join us virtually, and Jose Acacia from Australia, who is here with us in the room. Then we will consider some examples of our work in country in this context, and we'll hear from 5 different countries and areas. Now, keeping with our commitment to accountability in mind, we will end today's session with a presentation on the key findings of the For the Future stock-taking exercise. Tomorrow, we will continue this item, as mentioned by the Vice Chair, during 2 time slots. 7:45 a.m., which is a time more convenient for Pacific Island countries, and we'll be happy to see Pacific countries tomorrow morning at 7:45 a.m. Japan time, and the other slot at 2:45 p.m., which is more convenient for those who are joining us in the room or who are in the similar time zone. The deliberation of tomorrow will then be summarized and reported on Friday before the item is closed. Thank you, Mr. Vice Chairperson.
Thank you, Dr. Kasai and Dr. Capuano. It is now my pleasure to introduce the chair of the Sustainable Financing Working Group, Mr. Björn Kummel from Germany. Joining us from Berlin, where it is very early in the morning, he will be followed by Mr. Jose Acacia from Australia, the Western Pacific Regional Vice Chair of the Working Group. Mr. Kummel, you have the floor.
Thank you very much, Honorable Chair, Honorable Ministers, distinguished delegates, Regional Director. It's a great honor and pleasure to be with you. And indeed, it's early in the morning, but I share this experience with many of my colleagues with you currently when they are participating in the working group that I have the honor and pleasure to chair. So I'm with you with full commitment and in the same spirit as you are with us when we're meeting in Geneva. The COVID-19 pandemic has highlighted the importance of WHO and that the world needs WHO now more than ever. All COVID lessons learned panels clarify 2 things. A strong and capable WHO is key to implement the health-related sustainable development goals, and we will not reach global health security without a strong and truly enabled WHO. At the same time, the current crisis has also brought forth the gap between our expectations vis-à-vis the WHO and what the organization is able to deliver with the available resources and capacities. There is a major discrepancy between the world's expectation vis-à-vis the WHO and its de facto capacities. Or in other words, there's a major discrepancy between us member states praising the relevance of the WHO and our willingness to pay for this. Today, WHO's program budget is more than 84% driven by individual donors. And only 16% of the funding is truly predictable. This situation has been a long-term challenge for the WHO, but certainly it has reached a point that seems hardly acceptable. This is the reason why the World Health Assembly called on member states in the context of COVID-19 pandemic to provide sustainable funding to the WHO to ensure that the organization can respond fully to public health needs. And subsequently, the working group that I have the honor and pleasure to chair was established in order to ensure WHO to have the robust structures and capacities needed to fulfill its core functions as defined in the Constitution. All independent experts, including the IPPPR, the IEOAC, the IOAC, the IHR Review Committee, the G20 High-Level Independent Panel, and the Global Preparedness Monitoring Board that has just launched its report yesterday, share the same assessment. And I could go on with that list of independent experts. WHO's financing is fundamentally rotten. And this assessment is not new. There have been several attempts in the past to fix it, and RD has just alluded to that. However, no major improvements have happened over the past 30 years. The working group discussed the entire situation. What are the consequences of the current way of financing? And I think in this way, it is very useful to link this debate to the work that is currently happening in countries and in the regions, like you are doing this in your regional committee. Since donors provide about 84% of the resources, and since only those activities get done which are funded, it is de facto the donors who set the priorities to a large extent of this organization, and not the member states. Although as member states, we always praise this organization to be member state owned and member state driven. It seems that donors value the relevance of WHO more than us member states, since so far it's the donors who provide 84% of the financing and not the membership of this organization. WHO needs to manage over 2,000 awards with different reporting requirements. The constant fundraising activities diverts attention and resources away from the technical work, which is needed. The various independent panels clarify that if there is one key magic bullet to efficiency savings, then it's changing the way we are financing the WHO. There is today a heavy donor reliance, which means a reduced predictability, both for programs and attracting talent that are important and needed for the work in countries. WHO's responsiveness to react to new events, emerging threats, is seriously hampered. Priority areas such as emergency preparedness, but also non-communicable diseases continue to be chronically underfunded. This has major negative implications for WHO's work in the regions and at country level. And I'm sure all the colleagues that we just saw in the country offices could bring in their experience on this. With the current financing mix, the WHO is unable to put the money to the needs, but also to put the right staffing to the right destinations. The working group met 4 times already in full inclusivity. All member states were asked to participate, and all member states who wanted participated, and your region was a very active region. So there is full inclusivity ensured in the work of the working group. The first 2 working sessions looked at the historic context, the underlying issues related to WHO's reliance on voluntary funding and different options how to move ahead. The third session specifically looked at the recommendations from the Independent Panel for Pandemic Preparedness and Response, including their proposal to increase the assessed contributions to 2/3 of the base segment of the program budget. Yes, the discussions have been cautious. Yes, they have been very difficult, but this is not business as usual. We are in historic times, making historic decisions, and some call this as the new Bretton Woods moment. We have brought up 5 questions, and Jose will bring them just in a second. 5 regional committees have met before, so you are the one we are looking in now. And I try to give you an overview where we currently are in the debates. 4 regional committees expressed their strong support for the ongoing work and for the options that we are currently debating. 1 regional committee was more skeptical, but it needs to be taken into account, and they raised fiscal constraints due to the specific structure of that regional committee. with a double burden because they are also raising assessed contributions for their specific structure. The replenishment that we will hear also from Jose in the question was raised in informal debates that I held with Gavi and Global Fund, the World Bank, state and non-state donors. And those discussions went very, very promising. It showed that the replenishment idea could be something that could be of major success also in the WHO setting. The fourth working group, so the last one before this regional committee, discussed all of this, and member states are now asked to send in their ideas and recommendate for final recommendations actually until the end of this week. And after that, we will draft our final report, which will then be discussed and finalized in the fifth working group mid-December to then be sent to the executive board. Will we get there? Will we be successful in this endeavor? Well, we will see in the end. What are the options? Are there any possible options that we didn't raise? Are there any low-hanging fruits? And my answer to this is very clear. No. We have discussed all options, and there are no low-hanging fruits. We have discussed innovative financing, which is a theme that comes up again and again, but nobody brings up a concrete proposal for innovative financing. So there is no concrete proposal on this. Broadening the donor base has come up over the last 10 years that I've been covering WHO again and again, but no new donors were brought up. So also this option in reality doesn't exist. Efficiency savings, we've discussed that. The independent experts clarify that there is one magic bullet to efficiency savings, and that is changing the way we are financing the WHO, namely through more predictable, flexible resources. Priority setting, we did this, we tried this in the working group, and we hit the wall. So I doubt that that is something that, at least in this exercise, we would be able to successfully achieve. Program support costs, well, we learned that we did this before in 2013, and we were unable to further raise them, but there is certainly a way, but this is not a magic bullet. This is not a game changer for where we are. So the solution will only come if we member states move beyond our expectations and change the way we are ourselves financing this organization. In the last working group, 20 delegations explicitly supported a strong increase in assessed contributions, and 5 delegations were reluctant and said that they are against this. Many others came in, but not explicitly positioned themselves versus an AC increase. The additional investments we are discussing for the WHO are limited. They are dwarfed. They are peanuts compared to the trillions spent in the response already and the billions that we will need to invest further to recover. And clearly they make a compelling return on investment. We have to be clear about 2 things, and then I will come to an end. First, this is now or never, and all independent panels clarify this. If in the wake of this largest global crisis since many decades, we are unable to fundamentally fix this historic challenge of WHO's financing, we might not get a second chance. All independent panels clarify that we have a historic opportunity to put WHO's finances back on track. Second, if we are not finding a consensus for a concrete proposal to fix this historic challenge, then this is also a decision that we are taking. And we need to be crystal clear about that. Namely, it would be this decision that we are keeping the status quo, which keeps WHO vulnerable and limits its ability to help member states, also in particular in the country setting, preventing the next crisis and implementing the health-related sustainable development goals. Or even worse, the world does not wait for our boldness and our consensus in the WHO. if we are unable to truly enable the truly inclusive multilateral organization for global health, our WHO, with the needed resources, the world will create other capable actors who might be less inclusive, less transparent, and mandate them for important tasks in global health security and beyond. And it's a reality that discussions are already happening in this regard outside the governance sphere of the WHO, and the WHO discussions could easily be overtaken by facts created by these parallel tracks. So it lies in our hands whether we are in consensus, moving beyond our comfort levels and truly enable the WHO, or whether we stick to the status quo and will have to watch how the WHO's role will diminish over time as other actors will grow financially, but also with regards to their mandates. And it comes back to one essential question, and I think we will see this in the end of the ongoing debates, practically mid-December. Do we really have a consensus to strengthen this organization? Because if we want, we have to put the money on the table. And we are able to do so. All of us are able to move beyond our comfort levels. It's a question of political will. And I think we will all be held to account individually, whether we come with this political will or whether we are not coming with a political will to truly enable WHO for the task ahead. Now I will give the floor to my fellow Bureau member, Jose, who will introduce the 5 questions of the working group that the working group has transmitted to the regional committees. But I stand ready to answer any questions that you might have. Thank you very much for your time. And I know I took longer than the foreseen 10 minutes.
Thank you very much, Björn. Good afternoon. Well, thank you very much for that stirring introduction and appeal for change. Good afternoon and evening, Honourable Ministers, Adi Kasai, colleagues, and good morning, very early morning to Björn and other colleagues who are following along in Europe. I'm really pleased to be able to address our region again in Australia's capacity as a member of the Working Group's Bureau. If I can have the slides, please, colleagues in the Secretariat. Thank you, and then just one more slide. Okay. So as Björn had introduced, the Working Group on Sustainable Financing in June established 5 questions to help focus Member States' discussions in each of the 6 regional committee meetings. As we heard, Member States in the other 5 regions variously made cases for investment in WHO and its financing. Excuse me, next slide, please. So these questions were not drawn arbitrarily or unilaterally. They were the product of almost 6 days of discussion and also benefited from starting points by the recommendations of the IPPR and the other panels. I'll read through them quite quickly, but these are in the agenda paper for this particular item. So the first one addresses pardon me, the base program budget and the prospect of it being majority funded through assessed contributions, asking, do Member States share the view that WHO's base segment of the program budget should at least be 50% funded by assessed contributions, so the membership fees, if you like, from member states, to ensure the integrity and safeguard the independence of WHO. So offering that a credible base by which member states can command the direction of the budget. So the second question addresses the earmarking of the base budgets. Do member states share the view of the independent panel on pandemic preparedness and response in its recommendation that the entire base budget should be fully funded by unearmarked flexible contributions? The third question for member states, would they support next year's World Health Assembly, WHA 75, to agree on the way forward for an AC increase and adopting an incremental implementation schedule? So each of those elements is quite important. The fourth question, do member states agree to explore the IPPR recommendation for a replenishment model to cover the remaining part of the base segment of the program budget, both by member states and non-state actors? So really the prospect before member states is whether recommendations should explore a replenishment to cover the rest of the base program budget. And finally, the fifth question is a bit more open-ended. What are the best practices and lessons learned for prioritization in the regions? We'd heard quite vocal arguments for prioritization in the various working group discussions, and it's a useful question to have among those that oppose to member states. If I could have the next slide, please. So the 5 questions were intended to stimulate discussion among member states, and as Björn had mentioned, to draw comments of support as well as unveiling areas of concern that can then be addressed and help inform the recommendations of the working group as they're developed in the next couple of months. The RCM here is our best opportunity so far for our region to contribute to live discussions on the issue. It's really important that we have a strong discussion. On behalf of the Bureau, we really look forward to open and constructive contributions at the 2 plenary sessions tomorrow, as you can see there, at Thursday's meeting, and as the Secretariat had mentioned, following those plenary discussions on Thursday, there will be a summary of the member state discussions based on the questions posed by the working group, as well as commonalities among the member state interventions. And that will be brought together at the conclusion of the item on Friday. So just on the left there, you'll be familiar with the tentative schedule and where those plenary discussions will notionally be placed tomorrow. So just to keep an eye out for when you'll want to contribute. At the outcome of those member state discussions will be transmitted to the Bureau for consideration when preparing the 0 draft of the final report, as well as to the 5th meeting of the member state working group. If I could have the next slide, please. So projecting ahead to January next year, all of the work of the working group on sustainable financing to date has been fulfilling the group's mandate to develop a final report to EB 150. And this week we have a unique opportunity to hear live from ministers and senior officials and other delegates on member states' national positions. But supporting this as well, the Bureau encourages written submissions to inform the 0 draft of the working group's report to EB 150. And as you can see here, the Bureau will circulate that 0 draft on the basis of those written inputs, inviting comments on that 0 draft. In the Western Pacific region, we lobbied strongly in the working group for this written pathway for inputs. This offers greater capacity for as many member states to contribute as possible, noticing that we're dispersed across a number of different time zones. And also it provides an important basis for the necessary discussions among health ministries, finance ministries, foreign ministries, and the relevant levels of government in order to bring those the meaningful, robust national positions. A further draft will be prepared as the basis of discussion for the 5th working group meeting there, the 13th to the 15th of December, which will finalise the report to EB 150. And this timeline, this trajectory is in the agenda paper if you need to refer to it again. If I could have the next slide, please. So the inputs to the 0 draft, that deadline, it was extended as far as possible to the end of this week to ensure that those inputs could be informed by the debate that we're having among member states this week. The written inputs are due this Friday, close of business at Geneva time, which for a great deal of our region is Saturday morning, via email to the Secretariat at this email address here. And I've circulated that email address, as has the HQ Secretariat, to all of the missions, and I've circulated to our ministry contacts here as well. If I could have the next slide, please. So as the Bureau member for the Western Pacific region, Australia is really very happy to discuss bilaterally in the margins of today's meeting, or of this week's meeting here in Himeji, or via phone or email, for those of you who aren't here in the room or in the building. kind of take the opportunity to just to emphasize again the critical step of engaging across ministries and levels of government, and hope that the elevated profile of discussions here in the room and virtually among ministers gives that momentum for conversations across government. And if I could, one more slide, please. So thank you to the Secretariat for having prepared the agenda paper. The 5 focus questions for the discussion in plenary are on page 2 of that paper. It's, as you can see there, it's RC72/inf/4 for future reference. So they'll be a really useful basis for framing your discussions, our discussions, I should say, in the plenary discussions tomorrow. Thanks very much, everyone, and I'll leave my intervention there.
Thank you, Mr. Kummel and Mr. Akashio. I will now hand over to Dr. Capuano to moderate the rest of the session. Over to you, Dr. Capuano.
Thank you, Vice Chairperson. As explained earlier by the Regional Director, sustainable financing is critically important for WHO to be effective at country level. Building on the legacy of the former Regional Director, Dr. Shin-Young Soo, WHO in the Western Pacific region continues to put significant efforts into keeping countries at the center of our work. Regional and country office staff have been working as one team to contextualize and tailor global work to the unique context of countries in the region, but also to bring regional issues to global level, as we have seen with rheumatic heart disease or the safe and affordable surgery agenda. Over the past year, we have been responding to COVID-19 while continuously working towards strengthening our work in countries and driving forward the For the Future vision. We would now like to present 5 examples of our work in and with countries and areas over the last year. Some of these will allow us to reflect on the relationship between WHO's work in country and sustainable financing. Now let's move to our country examples and take a trip around our region. For each example, I will ask our WHO representative or senior staff to introduce a very short video before we hear from the Minister of Health or Senior Ministry of Health official on this work. And our first stop is in the Lao People's Democratic Republic. And I'd like to invite our former WHO representative in Lao PDR, Dr. Mark Jacobs, to take the floor. Mark, the floor is yours.
Thank you very much, Corinne. It's my pleasure to be connected today from Fiji, where I'm now serving as the WHO representative to the South Pacific and Director of Pacific Technical Support. I'm really pleased to be joined by the Honourable Minister of Health from Lao PDR, Dr. Bunpeng Pumalesit, who's in Himeji for this hybrid RCM. So, my dear Minister, we'd like to show you a short video on WHO's work in Lao PDR focused on the COVID-19 response before we hear more on this from Dr. Bunpeng. So please play the video. In the Lao People's Democratic Republic, WHO has been working with the government for many years to prepare for health emergencies, guided by the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies, and to help strengthen the health system. This includes work to improve surveillance and laboratory capacity, service delivery, and the health information system. These investments, among others, contributed to an effective COVID-19 response. Investments in the District Health Information Systems dashboard ensured timely COVID-19 updates. These updates informed decision-making and linked surveillance with hospital preparedness for new cases. As a trusted convener, WHO helped to coordinate the support of more than 50 partners during the COVID-19 response. They helped to provide technical assistance, fill funding gaps, and ensure the availability of necessary equipment and supplies for the response. Working as one team, the WHO Regional Office and WHO Country Office staff in the Lao People's Democratic Republic procured supplies for the response. Supplies included portable PCR test kits and other items, enabling 10 provincial laboratories to quickly scale up testing for COVID-19. Together, WHO and the Ministry of Health also worked beyond the health sector to train local government officials to identify sick people, monitor close contacts, and build demand for vaccination. WHO also provided training to local monks to keep everyone safe during religious activities. Moving forward and leveraging the one-team approach, WHO will continue to support the Ministry of Health to build stronger systems and partnerships, as well as work with other sectors. This is increasingly important because effective responses to COVID-19 and many other health challenges rely on action beyond health.
Minister, this short video highlighted just a few examples of how investments, not just in emergency response capacity, but also in health system strengthening, provided a solid foundation for Lao PDR's strong response to COVID-19. Can you tell us a bit more about this and perhaps expand on what we saw in this short video? Over to you.
Yes, thank you, Mark. As of 27 October 2021, there have been 37,751 confirmed COVID-19 cases since the start of the pandemic, including 58 confirmed deaths. Following an influx of the returnee workers in July entering Lao PDR, a surge of imported cases was observed, and from September 2021, the proportion of locally acquired cases and trend has increased. The government of Laos is responding to the current outbreak and discussing how to manage endemic COVID-19 together with WHO and partners. A great progress has been made in vaccination. So far, almost 40% of the entire population have completed recommended doses. Without major safety issue, I thanks to COVAX and other donors. WHO has been working with the Ministry of Health to strengthen IHR core capacity using upset 3 over the past 16 years, both in peacetime and through our efforts to respond to public health emergency like outbreaks of dengue and measles and flooding disaster. And much broader investment in the health system have contributed to strengthening this capacity. WHO support to the development of the District Health Information System, or DHIS2, has been a critical contribution. My team has been working very closely with the Health Information Technical Officer in the WHO office in Lao PDR. This is an excellent on-the-ground support. And as you saw in the video, a stronger surveillance system and the DHIS supported timely update on the COVID-19 situation and monitoring hospital bed capacity to improve hospital readiness for COVID-19 cases. COVID-19 has pushed us to work beyond health. This is an operational shift-in for the future, and COVID-19 has really shown how important this is. Other sectors see how central health is to other aspects of life, and we are seeing the role other sectors play in tackling COVID-19 and addressing other health challenges related with health indicators. WHO has supported our efforts to do this, and we have partnered with the Lao Front for National Development to train monks, as you saw in the video, so they could protect themselves and also lead the communities by example. Together, we also involve police, military, and animal health officers in Lao field epidemiology training supported by WHO and other partners. Because WHO is supporting system development over the longer term rather than short-term projects in specific areas, it is the partner best placed to coordinate other partners. We saw how important this was as we sought to identify needs and gaps that other development partners could step in and fill. So we are, of course, still responding to the COVID-19 and doing our best to meet our population other health needs. We are also trying to strengthen the resilience of our health system and prepare our health for the future. For this, we will continue to strongly collaborate with WHO support and other partners.
Prop Minister, if I could just finish on what I think are two really important points. One is the crucial importance during emergencies and emergency responses of there being an ongoing close relationship between the Ministry of Health and Government and WHO in country. And secondly, just as strengthening emergency response capacities is a big opportunity to strengthen health system capacities more broadly, health system strengthening efforts themselves can also have big benefits during emergency responses. So thank you, and back to you, Corinne.
Thank you very much, Honourable Minister, and thanks, Mark, for sharing those reflections and very interesting work. Our next stop will be French Polynesia, and I would like to invite our Pacific Health Cluster Coordinator, Sean Kaze, also joining us from Fiji, to take the floor, and you may want to utilize those small devices, as one of our features is that we also speak many languages, and this part will be in French. Over to you, Sean.
Merci, Dr. Capuano. J'ai le plaisir d'être ici aujourd'hui virtuellement avec l'honorable ministre Jacques Ranal.
Thank you, Dr. Capuano. It is a pleasure for me with the Honorable Dr. Jacques Ranal
vidéo sur notre collaboration avec
to present to you a video on our cooperation with the French Polynesia on the response to COVID-19 prior to giving the floor to the minister himself. Together, the Regional Bureau of the WHO and its 15 country offices support the 37 countries and territories of the Western Pacific area, 22 of which are located in the Pacific. WHO has no physical presence in French Polynesia, but has given its support since the first detection of COVID-19 in March 2020. The Minister of Health of French Polynesia entertain close collaboration with the Technical Support Division in the Pacific, which is a decentralized division of the Regional Bureau of the WHO located in Fiji. Further, the coordinator of the health cluster of the WHO in the Pacific, based in Fiji, was deployed twice to face different waves of COVID-19. The first deployment supported the ministry and government in order to quickly set up a COVID-19 crisis cell while taking a major action in support of the crisis management of the cell. WHO also helped in fighting COVID-19. The decisive action undertaken by government with the support of WHO made it possible through a connected approach to block the first wave. In the second wave, this same approach enabled us to draw on the expertise of our partners in the Goran World Network in order to guarantee technical support in the field in French Polynesia. through collaboration between its technical support division in the Pacific and the regional bureau offices, and WHO continues to supply support, bespoke support to French Polynesia and other insular states and territories in the Pacific and Western Pacific areas. Minister, we worked in close collaboration with French Polynesia in several fields in the last few years. You've just spent 2 years as the very dedicated president of the Council of Ministers of the Pacific, and French Polynesia supported other countries and territories in the region, deploying human resources and supplies during the measles epidemic in Samoa, for instance. And we collaborated with you and benefited from your support in primary health care, but in the last 18 months, basically COVID-19 has been the main focus of activity. Can you talk to us about the challenges you found and how we work together in order to respond to them? Yes, of course. Thank you. Thank you, Sean, for this presentation. First of all, I would like to greet our regional director, Dr. Kasai, for the regional organization, as well as Karine Capuano, whom we have quite often found helping us for various reasons. Also, the director of technical support for the Pacific, and all my colleagues, health ministers, all my colleagues, and the heads of the different actions undertaken in the Pacific. And this, in fact, was a collaboration which started from the very first days of COVID. And in fact, we were able to keep you here for a while, twice. Once mainly because when lockdown and confinement and various measures compelled you to stay with us. But as you said, of course, there is no WHO office in French Polynesia, but COVID-19, in fact, defied all of us. And we are very grateful that the WHO provides us a multifaceted report, particularly the deployment of many experts like yourself to support our efforts and our cooperation in order to establish the crisis cell was essential, especially at the beginning of the crisis, and more particularly in its first phase, where we had to bring together a whole series of functions and work through numerous unknown elements. So this was a novelty for us, and the WHO helped us identify critical actions to be undertaken and enabled us also to overcome the failings that we had in the first phase. And having an expert of the WHO to guarantee communication with the neutrality and a technical capacity also strengthened our communication efforts at various times in our response. WHO staff and personnel that you deployed, as well as the experts, were always integrated to the team, and we feel that we are members of the large WHO family, with the support coming from Suvan Manila and Dr. Kasai, who was with us, the health minister for the Pacific, and the offers of support and quick deployment of French-speaking personnel from the Suva office, who work side by side with us in order to carry out our task. Of course, we are very impatient to continue to work with you and to be able to welcome you shortly, perhaps, as well as all the other collaborators that we've had. And in this regard, I wish to thank, of course, Dr. Takeshi Kasai, more particularly because he has always kept a very vigilant eye on our Pacific region. So thank you very much, Sean, for this intervention. Thank you, Minister, for your marvelous cooperation during the last years. Thank you very much. Well, I'm the one thanking you, and I wish you a good meeting and successful. Thank you, Minister. It's always a pleasure to be with you again, and it was a pleasure to share these comments from Papeete. Thank you for your intervention.
Dr. Yuta Setoya from our Tonga country office to take the floor. Yuta, you have the floor.
Thank you, Corinne. It's great to be joining you all from Tonga with Honorable Minister Dr. Amelia Tuipulotu. We'd like to show you a short video on Tonga's effort to roll out COVID-19 vaccine in the remote islands before we hear more on this from Minister Amelia. Please show the video.
The Pacific, with its vast distances and dispersed populations, faces unique service delivery challenges. Recognizing the need to reach the hardest to reach, the government of Tonga, where COVID-19 has been contained, has gone to extraordinary length to vaccinate its eligible population. Working hand in hand through the WHO-led Pacific Joint Incident Management Team, WHO and UNICEF supported Tonga to develop and implement its national vaccine deployment plan.
COVAX vaccines and other supplies were donated by Australia, Japan, New Zealand, and the Asian Development Bank.
The Ministry of Health led Talanoa information sessions at the village level in the weeks prior to the vaccination sessions. Over a few weeks, with Australia's support, 2 military boats visited every island in Tonga. Having already built demand for vaccination, teams at each site registered, immunized, and created vaccine records in one session.
On every island, vaccinators also visited the homes of the elderly and people with disabilities.
On smaller islands, nearly 100% of the eligible population has received their first dose of COVID-19 vaccine. Tonga's effort in collaboration with partners have helped the country to vaccinate close to the entire adult population, including those hardest to reach.
Even with this impressive milestone, WHO will continue to support Tonga and other Pacific Island countries and areas because we all know that no one is safe until everyone is safe. Minister Amelia, Tonga, as in other Pacific Islands, countries and areas, has many remote and isolated islands. However, as we just saw in the video, Tonga has defied the challenges of securing enough doses for the population and vaccinating those people, even in the remotest island. Can you tell us a bit more about this? Minister, you need to unmute. Yeah, thank you. It's unmuted now. Yeah. Please go ahead.
Maloe Laumalie and warm greetings from the Kingdom of Tonga. First, I would like to acknowledge the great work of Dr. Yutaro Setoya and his continual support to the Ministry of Health and the people of the Kingdom of Tonga. And of course, joining us in our deployment at the very tough, small, isolated islands of the Kingdom. In the Pacific, we are facing unique vulnerabilities of our populations are extremely small and dispersed in vast, often rough oceans, making service delivery a challenge at best times. Deployments have been delayed for some days due to rough seas. We have high rates of NCDs, often families living together in large families in small spaces. That place our population at greater risk towards COVID-19. Many of our countries are also heavily dependent on tourism. All of these factors, with weak healthcare system, among others, make a compelling case for ensuring extremely high coverage with COVID-19 vaccines. And new normal public health social measures must be the everyday lived realities within the communities, before border restrictions are slowly and diligently relaxed with tight monitoring and tracking. From the start, WHO has provided guidance to prioritize vaccination to those at higher risk, healthcare workers, older people, and adults with comorbidities, ahead of the rest of the eligible population, and to ensure no doses are wasted. Due to projected and analysis of vaccination rollout, Tonga, through the support of COVAX, UNICEF, and of course WHO, successfully deployed vaccines from Tonga to Vietnam. This is a huge international high competent task delivered well to prevent vaccine wastage and save more people in the Western Pacific region. Through the WHO-led Joint Incident Management Team, WHO and UNICEF helped us and other Pacific countries to develop our own national vaccine deployment plan. The process we undertook to develop this plan set us in a good step for this unprecedented rollout of new vaccines to a new adult population as quickly as possible across every island of Tonga. Recognizing our unique vulnerabilities, WHO, UNICEF, and regional partners, including Australia, China, Japan, New Zealand, United States of America, Asian Development Bank, have all helped Pacific Island countries and areas to access adequate for close to their eligible population, access to vaccines. This is critical for small island developing states and the Pacific, where potential risk of eradication of a generation is extremely high. Based on our rollout plan, teams spent a few weeks traveling island to island by boat to register, vaccinate, and record the vaccination of every eligible adult. Before that, you saw on the video, we'd taken time to meet with communities, answer questions about COVID-19 vaccines, and explain to them our plans for COVID-19 rollout. We made sure people are ready and are willing when we arrive on the island and set ourselves up for the vaccination session. With more than 85% of our eligible population having now received at least one of our vaccine doses, first doses, and 60% fully vaccinated, we already feel a great sense of achievement. We've still got a way to go to ensure that many has their second dose, but we have the system in place and we know exactly what to do. We have also started vaccinating those from 12 to 17 years old, starting from Thursday last week, and it is now at 25% coverage. We are grateful to have WHO alongside us from the start and the support of all our regional partners. Finally, we are absolutely committed to protecting every Tonga from severe COVID-19. We will not rest until we reach the often difficult and unreached islands, furthest north-flung islands of Tonga, who are closer to Samoa than Tonga's capital. I thank you, Dr. Yutaro.
Thank you so much, Minister. This really has been a huge effort with health workers traveling long distances by boat for vaccination sessions and putting in place arrangements to ensure delivery of usual health services. We're committed as WHO to working with you for the remainder of the vaccination campaign and the preparation for the response to COVID-19 and planning for the gradual relaxation of border control measures. Malo apito, Minister. Back to you, Corinne.
Thank you so much, Minister Amelia, for sharing with us this fantastic work that you've been leading, and thanks, Yuta. Our next stop is Vietnam. And I'd like to invite Dr. Trang Huang, our Director, Division of Disease Control Programs, here with us in Himeji, to take the floor. Huang, you have the floor.
Thank you very much, DPM. It's my pleasure to be joined online by Dr. Trần Thị Mai Oanh, Director of Health Strategy and Policy Institute, Ministry of Health of Vietnam. I would like to show you a short video on the work that Vietnam and WHO have been doing to reach more people with NCD services. Please show the video.
Nearly 3 out of every 4 deaths in Vietnam are caused by non-communicable diseases or NCDs. For many with chronic NCDs, accessing the care and support they need to live healthy and productive lives is a challenge. Considering the needs of communities and taking a system approach, WHO is providing tailored support to the Ministry of Health. This support aims to help strengthen the capacity of nearly 11,000 communal health centers for early detection and management of NCDs. Working together, the Ministry of Health and WHO developed a public health approach to NCD management to make small changes on a large scale, moving the management of hypertension from hospital to communal health centers was the starting point. Most communal health centers now manage hypertension, and step by step they are taking over the management of other non-communicable conditions such as diabetes. With WHO support, monitoring of NCDs has been also strengthened. This experience has shaped the new National Action Plan for NCD for 2021 to 2025, now with the Prime Minister for approval. This plan will further strengthen the work on the ground. The plan applies a system approach to strengthen communal health center capacity to manage NCDs. With WHO support, this work is helping to strengthen primary health care more broadly towards the goal of universal health coverage.
Good morning, Dr. Wang from Himeji, Japan. It's very nice seeing you on the screen. We just saw a short video that NCD is a pressing public health priority in Vietnam. Can you tell us a little bit more about this? Over to you.
Sorry. Okay, sorry. Okay, so good morning, everyone from Vietnam. Thank you, Dr. Hương, for the questions that give me opportunity to elaborate more about the situation of Vietnam in terms of the NCD prevention and control. So similarity to other countries in the world, Vietnam is facing with the high burdens of NCD. Since NCD is become a leading morbidity and mortalities, and nearly 80% of deaths caused by NCDs in Vietnam, of which 31% are from cardiovascular disease and 90% from cancer. So the rise of NCD has been driven by primarily 4 major risk factors, including tobacco use, the physical inactivities, the harmful use of alcohol, and also with the unhealthy diets. And the epidemics of NCD causes the health consequences to the individuals, families, and communities, and also threatened to the health system in Vietnam.
Thank you very much, Dr. Wang, for sharing with us more about the challenges that Vietnam is facing with NCD burdens. I understand that in Vietnam, like elsewhere, development partner support to address the high burden of NCDs has typically very limited and has mostly taken the form of short-term pilot-style projects where it has been provided. It's also an area that it has been difficult for the government to identify or allocate resources for. Over the past years, WHO and the Ministry of Health of Vietnam has been working together on this area. Can you share with us more about this work?
Thank you. As mentioned, NCD account for the vast majority of deaths in Vietnam, and it requires urgent intervention to prevent NCD prevention. However, domestic and donor resources have been and remain very limited in NCD prevention and control. Whilst Vietnam has received some support in the form of short-term and small-scale pilots to improve NCD prevention and control from some international projects, WHO's support takes a different approach in a sustainable manner, in which WHO provides technical support to strengthen Vietnam's healthcare system as a whole and focuses on primary healthcare and healthcare at the grassroots level. This is a long-term support that WHO is providing as we redesign and reorganize the health system for early detections and to bring cost-effectiveness NCD management closest to the people who need it. This work started back in 2013 and 2014 when WHO helped us facilitate a process to develop an NCD action plan to tackle what we call our future already occurring. WHO's approach has helped us close the gaps between those living with NCD and those receiving treatment for NCD. It is very much a system approach that we are applying, and it has actually helped us to reach more people and ensure they get the care they need. WHO's treatment guidelines such as pain, heart, are seen as an useful document for us. The COVID-19 pandemic has brought urgency to this work since people with NCD are so much more susceptible to the surfaces of the disease, and stress the importance of having a strong primary healthcare system to maintain essential healthcare services. It means that WHO support will remain critical in addressing the increasing burden of non-communicable disease and in implementing the new National Action Plan for NCD 2021 and 2025. WHO has been our trusted and reliable partners. We look forward to continue receiving a long-term and sustainable support from WHO, as well as to work together with WHO on our health system reform, which support the prevention and control of NCD, including strengthening primary healthcare system to increase the availability of and access to the essential medicines for NCD as well as other diseases. So in conclusion, I would like to say that the support of the WHO country office and regional office are very important to help us design the sustainable health system for the future. So I thank you for Dr. Hương. Thank you very much.
Thank you so much, Dr. Wang, for sharing the work of Vietnam in doing with WHO support. It's really a system approach in sustainable manners that may be of interest to other countries which are facing similar challenges. Vietnam is working really hard to have a community health centers deliver more NCD services, which are typically delivered by hospitals. And we are very happy to be contributing to this and broader strengthening of primary healthcare as the result of making NCD services available close to the people where the people live, as part of the health system reforms in Vietnam. Thank you again, Dr. Wang, and back to you, DPM.
Thank you very much, Dr. Wang and Dr. Huang, for sharing those reflections. And our final stop on this journey today is Mongolia. I'd like to invite Amy Cawthorne, the coordinator in Data Strategy and Innovation Group, joining us online to take the floor. Amy, over to you.
Thank you, Corinne. It's great to be here with Mungtul, the Director of the Finance and Economics Department of Mongolia's Ministry of Health. First, we'd like to show you a short video on Mongolia's Health Futures work before we hear more on this from Mungtul. Please can we play the video?
Over the next 20 years, non-communicable diseases in Mongolia are expected to account for a significant increase in premature mortality. The proportion of people aged 60 years and older is projected to double by 2040. Service delivery is already a challenge with the vast distances and dispersed populations of Mongolia. In the coming years, the pressure on Mongolia's health system will be greater than ever as people's expectations are rising. Anticipating its future, Mongolia recently adopted its 2050 vision, including a long-term goal for health. The goal is in the next 30 years, Mongolia aims to create an environment for every citizen to enjoy a long, happy and healthy life. To meet this goal, innovative, long-term approaches are required to transform Mongolia's health system. Working together as one team, the WHO Regional Office and Mongolia Country Office are facilitating a Health Futures strategic dialogue. The process is based on an inclusive, country-specific approach that works backwards from the desired health future to today. This backcasting process identifies key steps to ensure the desired health future is achieved. WHO stands ready to support member states as they increasingly undertake this type of work to envisage and prepare for their futures.
As we saw in the video, Mongolia is expecting significant changes to its development and in terms of health and well-being in the coming decades. Mungtul, could you tell us a little bit more about these changes?
Thank you, Dr. Amy. Good morning and a warm greeting from Mongolia to honorary participants and representatives. It's an honor to join you today virtually to engage in dialogue with you on issues of common interest. As all the countries, Mongolia is working hard on health front to contain the spread of the virus and to save lives. At the same time, on the economic front, the country is using policy measures to their utmost limit to stabilize their economies while safeguarding people's livelihoods. Mongolia has made significant strides towards sustainable development. Following the SDGs 2030, Mongolia adopted Sustainable Development Vision 2030, and in May 2020, the Parliament adopted 2050 Agenda, renewing the Mongolia's long-term roadmap for sustainable development. Under the Vision 2050, the government is supporting intersectoral cooperation to deliver people-centered, integrated health services, achieve universal health coverage, leaving no one behind. However, the pandemic, the COVID-19, has had an enormous socioeconomic impact on Mongolia. The pandemic didn't just impede progress, it reversed many economic, social, and environmental gains, putting at risk the achievement of the Agenda 2030 and the country's Vision 2050 and its health targets. It has deepened already high debt levels, reducing the fiscal space for financing the SDGs and leaving a financial burden for future generations. COVID-19 also increased pressure on health system, and there's a risk that it tend to disrupt the delivery of essential services. Healthcare providers have been working day and night to respond to the COVID-19 and maintain services, especially for the vulnerable, the children, pregnant women, and elderly. The pandemic has served as a catalyst for reforms, including comprehensive laws on health insurance, decentralizing the medical services and drug regulation, digitalization and integration and strengthening management information systems to achieve SDGs and Vision 2050, and support implementation of programs and activities for their future's transformational agenda. Listing the key achievements over the last decade and the current changes is quite remarkable. The health financing is increasing steadily, giving greater flexibility to invest in the health delivery services, including introducing and adopting new technologies, enhancing prevention programs by opening up health development centers at all provinces and the city districts. Essential vaccinations are in place. Last but not least, primary healthcare centers and public health centers are in the core attention of decision makers in the country.
Thank you, Mungtul. If I can ask one other question, you mentioned the vision for 2050 for Mongolia, and this includes a goal for health, which is to create an environment in which every citizen in Mongolia can enjoy a long, happy and healthy life. Could you explain how the Health Futures Strategic Dialogue is supporting the achievement of this goal?
The Vision 2050 provides a general orientation for the health sector to achieve this objective as part of the country's broader long-term development ambitions. So based on that, with the assistance of the WHO and also the donor organizations, the Ministry of Health is strengthening its regulatory and financing framework using systematic approach, boldly shifting towards SDG-aligned and performance-based budgeting, strategic purchasing approach, exploring innovative financing mechanisms to enhance equity within the integrated financing framework in the distribution of the resources, increase efficiency, and provide quality healthcare services. The state health policy and health strategic documents are under revision to align the Vision 2050 and identifying changes and actions required to transform the health system, especially amid COVID-19. Since late 2019, the Ministry of Health and WHO have been working together to co-design and implement Health Futures Dialogue, Strategic Dialogue, a process that supports the development of this vision and the alignment of medium-term with the long-term objective. The support the WHO has provided is innovative and still is. As we saw in the video, WHO's strategic foresight process is based on backcasting, working backwards from the preferred future to identify steps that need to be taken now to get there. The approach is building the Ministry of Health capacity and its agencies to make sense of what is happening now and that could drive changes in the future. It's helping us to envision long-term, imagining different scenarios and stress testing strategies against them. It's also enabling us to break down silos and include diverse voices beyond expert views and beyond the health sector. COVID-19 has shown the relevance of this work since there are a number of emerging risks that health system will have to deal with in the future. So WHO's support in this area will remain critical, strengthening the capacity to assess the impacts of policy and programs and identify investments and interventions that could trigger progress across multiple SDGs targets is important for development policy and planning and financing. So the government of Mongolia, the Ministry of Health is stay committed to achieving universal health coverage and responding to rapidly changing situations. Thank you. Over to you.
Thank you very much, Mungtul, for sharing the experiences of Mongolia and the experiences you have in putting the health future for your country up front and using the Health Futures Strategic Dialogue process to do that. And we're very much looking forward to supporting Mongolia and other countries with this process in the coming years. Thank you very much. And over to you, Corinne.
Thank you so much, Mungtul, and thanks, Amy, for sharing this example. Thank you to each of the minister and each of the senior officials from Ministries of Health and staff who took us through this journey of our work in country today. Each of these country examples illustrated the way our one-team approach has facilitated greater efficiency in our work in and with countries and areas. They also showed the importance of carefully tailoring our support to the unique context of the countries and areas we serve. Several of these country examples are closely linked with the importance of WHO sustainable financing, and I'd like to further elaborate using some of these examples. First, we heard from Lao PDR, and one of the key points from the video and from what we heard from the Honourable Minister intervention was the importance of working for long term using a systems approach. 16 years of implementing the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies in Lao PDR is a living example of how a system approach with a long-term view pays off. However, this approach can be challenged by the short-term nature of WHO's budget combined with our reliance on heavily earmarked donor contribution. So the first reason why sustainable financing is critical is that it is enabling us to work for the long term using a systems approach. Now, as countries in the region continue to develop economically, they will increasingly transition away from receiving traditional donor funding. But many will still need support to sustain the gains made through decades of efforts in areas such as tuberculosis, malaria, maternal and child health, and WHO will need to provide this support. This is the second reason why sustainable financing is needed, to sustain and strengthen gains made in specific areas such as TB or malaria or maternal and child health, while traditional donor support is fading away. Mongolia and Vietnam, two countries we've heard from today, have both experienced this decline in donor funding.
You're muted, Corinne.
Please remind the speaker that her microphone is muted right now. We cannot hear her as interpreters.
Okay, so I pause here. So it seems that we have a little bit of a translation issue, so we pause.
It's just an issue with the English audio.
I'm told to try again to see if you can hear. Okay.
Yes, we can hear you now, but just now you were muted.
I'm not sure where it got cut off, so maybe I will just continue. The Health Future work in Mongolia is an example of the work we'll be increasingly asked to support as countries in the region develop and work towards the future. This is tailored support to countries to systematically and comprehensively apply a backcasting approach towards health system strengthening and development, which will rely on sustainable financing. This example speaks of a third reason why sustainable financing is so important, and that's because in endorsing the For the Future vision, Member States, you, the Regional Committee, you ask us to prioritize our work today to address the challenges of tomorrow. That means working not just for today, but for the future. And we heard yesterday so many interesting comments on school health. You are dreaming about primary health care of the future. You are dreaming about something new, something different. We heard about innovation, the innovation side event, all these compelling reasons why we need to do that. So working effectively and efficiently for the future isn't possible when we are relying on heavily earmarked, unpredictable, and short-term funding. So with that, we'll move to the next part of our agenda. I'm tempted to say, like the journalists would say, with no transition, but it's not true. Because this work in country session is part of our accountability to member states. In the past few years, we have really come to you to demonstrate the work we do. And the next part of this agenda is about the findings of the stock-taking exercise. And this is part of our accountability as well. 2 years ago, you endorsed the For the Future vision, as I mentioned. In between, and still now, it was put under the test by COVID-19. And it was, so this stock-taking exercise was conducted. So it is now my pleasure to introduce Mr. Martin Taylor, our Director of Health Systems and Services, to share some of the key findings of the stock-taking exercise. Martin, over to you.
Thank you very much, DPM. Honourable delegates, good morning, good afternoon, good evening. I think as the slides will be coming up on the screen now, as the DPM said, 2 years ago, the Regional Committee meeting endorsed the For the Future vision. So it is a very timely moment to take stock on implementation so far to help us in terms of advancing that vision, not least because of the COVID response for over 20 months, a significant proportion of the time since that vision was endorsed. So in this presentation, I'm going to give you a brief summary of the findings that you can see in the information document RC72/INF/3. If we can turn to the next slide, please. The scope of the stock-taking exercise included the 4 areas that you can see on the right. A review and recapping of the relevance of the For the Future vision, exploring progress in implementation so far, understanding the implications of COVID-19 for the vision and the future, and then finally identifying future directions. The methodology for the stocktake included what you can see on the left. There were desk reviews of a huge number of documents, high-level interviews with a range of partners and experts from across the region, and of course consultations with member states and internal consultations. If we can turn to the next slide, please. So in the next 5 or 6 slides, I'm going to present a brief summary of the findings according to those 4 areas in the scope. First of all, with regards to the scope, with regards to the relevance of the For the Future vision, we found that the stock-taking exercise reconfirmed very much the relevance of the vision. It reconfirmed the key elements of the diverse and rapidly changing region that is one of the drivers for the vision. It also reconfirmed our need within WHO to tailor our support to member states' precise and specific needs. And finally, it also reconfirmed the importance in our WHO legacy and strength in the region of keeping countries at the centre, working as one team across all 3 levels of WHO and working in partnership with other organisations. If we can turn to the next slide, please. This is just a brief reminder of the 4 thematic priorities in the For the Future vision and the operational shifts. And the stock-taking exercise reconfirmed the relevance of those, and for some, as I will explain later, the increased importance of some of them. So I don't think I need to dwell too much on this slide. That's a reminder of the key points that the stock-taking exercise reconfirmed. If we can turn to the next slide, please. This slide begins to give a brief summary of progress in implementation to date and some key pointers for priorities for the next few years. In terms of implementation to date, the stock-taking exercise identified good progress both at regional and country level on the 4 thematic priorities, as well as in taking forward the operational shifts. I don't think I need to give too many examples. We've heard a lot in the last few days, but just to highlight a few. So in the work around health security, the first thematic priority, we've just been hearing from DPM about the implementation of APSED. We've seen a huge amount of support in terms of development of guidance for COVID-19, work most recently, for example, on establishing the laboratory network for genomic sequencing and all the care pathways support. So some examples under the first thematic priority. Under the second one on NCDs and ageing, there's been the endorsement by the Regional Committee last year of the Ageing Action Plan, the establishment of the NCD tag, and support to member states in developing national plans, in particular a significant number for ageing. In the third priority area on climate change and environment, there's been the establishment also of a technical advisory group and work to establish strategic priority areas, engaging with other partners in the environment to position health firmly in climate change debates. And then finally, in the reaching the unreached area, strong development at regional level of a guidance document and work at countries, both in terms of implementing systems approaches and on some specific issues. And we've seen also the endorsement of a number of critical regional action plans and frameworks, for example, EPI and safe and affordable surgery. On implementation of operational shifts, we've just been hearing about the Health Future Strategic Dialogues in Mongolia, and that work is progressing in other countries too. There's been work around innovation with the Innovation Forum last year, and you saw an example of that in the Innovation Side event yesterday with the Health Avatar. Work on partnerships with many other organizations, in particular international financial institutions, but also the Partnership Forum earlier this year. And we've seen increased work on strategic communications, especially around COVID and preparing for the new future, a particular example in Papua New Guinea. So I highlight those as just some of the examples of work that we've seen in implementing both the thematic priorities and the operational shifts. When we turn to some of the key pointers for the coming years, clearly taking the Health Future Strategic Dialogues work further and deeper across more countries in the region is a priority if we're going to keep our vision of working for the future. Supporting implementation of the thematic priorities, in particular at country level, and one of the things from the stocktake exercise was not to forget subnational implementation and monitoring of progress on these thematic priorities. And then thirdly, to highlight institutionalizing in a deeper way the operational shifts within WHO and working with our partners on that. It's one thing for us to start, but it's another to take it deeper and further so they become second nature. If I turn next to the next part of the scope of this exercise, this turns to the impact of COVID-19. If we can have the next slide, please. So the stock-taking exercise found that the COVID-19 pandemic particularly reinforced the relevance and, importantly, the urgency of the For the Future implementation and the vision. In particular, it highlighted that the priorities outlined in For the Future are not just the future's problems, they are today's problems. And we've seen that and heard much in the last few days in the discussion around the need to focus on vulnerable and marginalized populations and on non-communicable diseases and older populations and the need to protect them from COVID-19. We also saw from the stock-taking exercise that COVID-19 has provided a situation where there are new opportunities for us to advance the For the Future vision. There is unprecedented interest in public health, in society at all levels, amongst individuals and governments. There's momentum and cross-sectoral partnerships that have been evolved and developed as a result of the COVID-19 response. And there's been an environment in which some innovations have been adopted that have been around for some time. We heard a little bit about that at the side event yesterday. That also culminates then in opportunities for leapfrogging, for member states to jump several steps forward in developing their health systems in a quicker way than might otherwise have evolved or developed. So that's a kind of brief summary of the implications of COVID-19 for the longer term vision and for our taking forward for the future. If we could turn to the next slide, please. So where this leaves us in terms of the final part of the scope of the exercise, in terms of how we take forward the vision, for the future vision. Clearly, the exercise and everything that I've just presented identifies the importance of accelerating implementation. We can't wait for the future. These are today's problems. And across the different thematic priorities, the exercise identified a number of key areas where we can it's particularly important to accelerate implementation across these priorities. Of course, the health security and building capacities for emergency response is a key area, not forgetting ongoing work around addressing antimicrobial resistance. Developing new approaches to NCD prevention and management are critical, and this has been highlighted and commented on in other agenda items in this regional committee meeting, as well as accelerating the implementation of the healthy ageing work. Climate change and environment, some critical areas there. Advocacy is a really important part, as well as the building of climate resilience, including in health facilities and systems. And then for reaching the unreached, COVID has identified the issues of vulnerability, or rather reinforced those. It emphasizes the need for us to work harder and deeper in building systems that can reach all populations so they can benefit from health services. If we can turn to the next slide, please. This is a quick statement on the implications for WHO and ourselves, our ability to deliver on this vision. The stock-taking exercise identified a number of areas where we can continue and should continue to strengthen our work and approach. A reminder you can see in the middle that for the future is our regional vision for the Western Pacific, that is to implement the GPW 13 and contribute towards the SDGs. Within that framework, we need to, as you can see on the left, continue to build our technical expertise, but also work in partnerships with those experts across our region in collaborating centres and other expert groups. Secondly, on the right, our capacity to work in partnership with other health partners and beyond the health sector is an area where we can continue to strengthen. And then thirdly, you can see on the left, strengthening to continue our tradition of working as one team to tailor our support to countries and their very specific needs. Within this, we've been piloting a hypothesis-driven approach to accelerate our work, and also, as you've heard on a number of times, the try and learn approach, where we can evolve and adapt our responses over a period of time. This, we hope, can help build on our legacy across the region and increase our effectiveness and promote accountability and the use of risk-based culture. So if we turn to the final slide, this summarizes just some of the top 3 messages. First of all, that the stock-taking exercise validated that the vision for the future remains valid and particularly even more relevant, especially in the context of COVID-19. Secondly, that the stock-taking exercise underlined the importance of taking on long-term challenges in our region and continuing to address the future challenges, many of which COVID has made more obvious than they were before. And then finally, that we in WHO and RIPRO need to continue to accelerate our implementation for the future in the thematic priorities and the operational shifts and enhance our own capacity to do so. And with the next slide, that is the conclusion of this presentation and a reminder about the key part of the vision, working to address the challenges of the future. Thank you for your kind attention. Back to you, DPM.
Thank you very much, Martin, for this presentation on the findings of the stock-taking exercise. This brings us to the end of the session. We hope it has been useful in providing some more insight into our work in and with countries and areas in the Western Pacific region over the past year as we responded to COVID-19 and we were driving the vision for the future. We hope this session has been helpful as well in illustrating how important sustainable financing is for the work WHO does in and with countries in our region. We look forward to hearing your intervention on these two items combined tomorrow. And we were reminded earlier that lunch is at 1:30 p.m. and we only have 20 minutes for it. So I am pleased, Mr. Vice Chair, to hand the floor back to you 2 minutes in advance of the cut-off time.
Thank you, Dr. Capuano and all the panelists. That was a very great and very interesting discussion. Honorable delegates, we will now suspend discussion on this agenda item until tomorrow's early morning session, commencing at 7:45 a.m. That is Japan time. Thank you very much. We will now break for lunch. I know you're all hungry. There will be a side event on mental health at 1:50 p.m. today, Japan time, here at the plenary hall. The same Zoom connection link as the session will be used. For representatives who wish to speak on agenda item 9, panel discussion on primary health care will be resumed this discussion at 2:45 this afternoon, Japan time. Thank you very much. Enjoy your lunch.
Recording stopped.